Call the Board of County Commission meeting for September 8th, 2020 here in Seminole County to order. We please ask that you silence all of your cell phones and any other electronic devices you may have. We appreciate everybody being here this morning and that we're doing this hybrid type meeting, finally getting back into the chambers in person and having the public be able to come in. For those that feel safe showing up, we appreciate that very much. So bear with us. This is a new venture for us, both technology as far as being here in person as well. So if we see any hiccups or experience any hiccups, we apologize in advance, and we'll pause if we need to so that the public is able to participate via the Zoom meeting. The Board of County Commissioner meeting work session for September 8, 2020 is being held both in person and virtually, utilizing communications media technology made permissible pursuant to the Governor's executive orders. This meeting may be viewed in person in the BCC chambers, on SGTV, on YouTube, and by registering to participate in the Zoom webinar. Residents can provide public comment in person or by registering to speak on the Seminole County website and Board of County Commissioners webpage. There you'll find a link to register for the webinar entitled Meeting, Webinar Registration, and Helpful Hints. If you're unable to join via computer or online, interested parties should call 407-665-0808. Again, that number is 407-665-0808 for additional information on how to participate via telephone. We will take public comment on the items as it appears on the agenda. In order to be recognized to speak, if you're using a computer or iPad, you will need to use your raise hand feature, or if you're calling in on a telephone, you will need to press *9. If you attend the meeting in person, you'll be required to wear a mask and social distance. If you are here in person and you are going to speak, we would ask that you fill out one of these yellow forms that can be found in the lobby. If you have any difficulties, we have staff members that will absolutely give you assistance in that matter. Also, sorry to Commissioner Carey will not be able to make it today. Commissioner Carey has had a death in the family, unfortunately, so she's unable to participate today. So our hearts and prayers are with the Carey family. Today we have Pastor Charles Jones with the Baptist AME in Geneva will be providing the invocation this morning, and Commissioner Constantine will lead us in the Pledge of Allegiance. Pastor Jones, thank you for being here. Please lead us in prayer.
Yes, can everybody hear me?
Yeah.
Yes, we can.
Can everybody hear me?
Yes, sir.
Okay, thank you, sir. It is an honor to be here this morning, and we will appreciate you that are in leadership in our county. We give God praise for all of you. So let's pray. Father, we thank you so much today for this privilege that we get to pray for these men and women who, God, are in places of leadership, God, that helps us as citizens, God, to navigate through these very difficult and dark times. And we ask that, God, that you would grant to them wisdom far beyond their years. And all that, God, that they might provide for us, God, the leadership that we need in these times of uncertainty. And I ask that you would give them, God, our ideas and put fresh thoughts in their minds, God, that they might do those things which would cause us, God, to prosper in the place in which we live. And I ask that you would give them protection and watch over and keep them safe. Bless this meeting, God, that it might be very productive, and that, God, that the citizens of this county might know that they have people in leadership that really care about us, God, who are people of this county. And we want to thank you. So, God, we pray this in Christ's name. Amen and amen.
Amen. Thank you, Pastor. Mr. Constantine?
In the wake of Labor Day, and thanking all those that work hard for our safety and our beloved country, I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Justice for all.
Thank you, Pastor Jones. We appreciate it very sincerely. Thank you, Commissioner Constantine, for leading us in the pledge. We have an announcement to make this morning. On Friday, August 28th, Seminole County government lost one of our own employees, Mr. Tamas Zagowski. Tamas, a distribution mechanic in our Environmental Services Department, tragically lost his life while repairing a water main in the Lake Mary area. He is survived by his wife, Carolina, and the two children. Tamas was universally liked by his co-workers, and his work ethic and passion for the job simply shined. Although he was a private man, his passion for his job was known by many. His family, friends, and colleagues are heartbroken at the sudden loss of such a wonderful individual. I'd like to invite Kurt to the podium to lead us in a prayer and a moment of silence on behalf of the family. Kurt.
Thank you, Commissioner. Will you all please join me in prayer? In the name of the Father, and of the Son, and of the Holy Spirit, amen. Almighty Father, eternal God, hear our prayers for your son, Tamas Zagowski, whom you called from this life to yourself. Grant him light, happiness, and peace. Let him pass in safety through the gates of death and live forever with all your saints in the light you promised to Abraham and to all his descendants in faith. Guard him from all harm on that great day of resurrection, and raise him up with all of your saints. Pardon his sins and give him eternal life in your kingdom. Lord, look tenderly upon Tamas's family, friends, and co-workers here in Seminole County. Please give them strength, consolation, and peace as they go through this most difficult time. Amen. Amen. Now, remembering our dear brother in Christ, Tamas, who was an employee, a co-worker, who was a son, a father, and husband, let us now honor him in a moment of silence. Amen. Thank you, Commissioner.
Thank you, Kurt. I'd now like to invite one of his co-workers down, Chris Graybosch. Chris is with our Environmental Services Department. He's going to be here to share a little bit more about Tamas and his time with the county.
Thank you very much for this opportunity to speak on behalf of Tamas. I'm going to attempt to kind of paint an image for people who may not have known him, so that way I can just show the appreciation that we had for Tamas with his short time here in Seminole County. So here we go. So when you first meet a stranger in passing and you don't see them for quite some time again, if you were to try and describe that person to somebody else, it would be a little difficult. That wasn't the case with Tamas. His first impression was just that, very impressive. Many of the guys on our team only met Tamas after he was hired with Seminole County, but I had the pleasure of knowing him in 2018 when he worked for a contractor. They were replacing all the water meters throughout the county, and so that's why I initially met him. At the time, he was a contractor for National Meter, and after meeting him, I could tell that that job was temporary for Tamas. They weren't going to be able to keep him. He had the drive and work ethic that shined bright, and he was known as the man at National Meter. Whenever we had an issue on a job site or the county had a problem while he was there, or while he was in the county, everybody knew we had to call Tamas. Always call Tamas. You have a problem, Tamas is the man. He quickly established his role as a powerhouse, and the frustrating part with Tamas was whenever he'd call me, he'd say, "Chris, we got a problem at this job." "All right, hold on, I'll come out." So 99% of the time, by the time I got there, he already fixed it. And I asked him, I said, "Why'd you call me out here if you were going to fix it before I got here?" Looking back, I realized he was trying to impress me for a job. So when we finally had the opportunity, we had a position open. Tamas was the first person to apply. And, sorry, my phone just rang. I lost my speed. So Tamas was the first one to apply, and I'm not going to lie, his interview was almost unfair to the other applicants. After he started working with the county, he brought 100% of his ethic. At some points, I would ask myself, "Dude, you're already here. You don't have to impress me anymore." And then I realized that was just him That was just his work ethic, the level of his determination. He brought it with whatever he did. A few months later, Tamas was promoted to a mechanic, and it was full steam ahead. He was assigned to the valve maintenance team, and he was always on the ball. He challenged me as a supervisor, and he completed work faster than I could assign it. He understood the importance of his position and the importance his role played in valve maintenance to the entire utilities department. He was on my toes, and he kept me accountable. Whenever he needed something from me, he was relentless. He wouldn't let me live it down until he got what he needed. Just recently, we had purchased a new job box, and this is a small thing, but he needed extra storage on the truck, so he drug me to Northern Tool, made me buy it, and we get back to the shop, and I just want to sit down and think about the day, and he's dragging me and the whole team outside so we can mount it to the truck. I didn't even know how we were going to mount it, but he had a vision in his head, and so he would not let me live it down. He was never afraid of a new challenge, and he never complained. Recently, we had paired him with another team member to learn locating throughout the county so he could cover when employees took PTO. And it wasn't for a few months until he told me, this really isn't my favorite thing to do. But he never bellyached. His ethic and determination carried every day, even when he was walking in the door knowing he was about to do something he really didn't like to do. He still came in with a smile. Tamas was a private man, and he was private about his personal life to many, or maybe just me because I was a supervisor and he was on probation, but after some time you could notice a change. During morning meetings, he was quick with a quip, or he'd cut up with someone, and many times I'd have to lean back and say, "Was that Tamas who just said that?" That's not something he would say, but in fact it was. He really started to grow into being one of the crew. He carried himself in such a way that you can tell he loved life and was happy. Tamas had a bob, a certain step in his walk. You could pick it out on New Year's Eve in Times Square. You could see him from a mile away. He was always determined. He outshined at work, and he was a true team player. Tamas was a beautiful person, and his tragic passing still brings a shock to all of us. Tom was one in a million. And he's a reminder that people and relationships are too precious to take advantage. Life is far too short. The world lost a great man, and I pray for his friends and family. You will truly be missed, Tamas. God bless you and your family, and may you rest in peace. Thank you.
Thank you, Chris. We sincerely appreciate that on behalf of the county and your team over at Environmental Services. Thank you very much. Chris Campbell, Caden Brown, and Chase Stubblefield, members of the Environmental Services Distribution Mechanic Team, were working with Tamas last Friday. Our thoughts are with them as they mourn the loss of their co-worker. During the rescue attempt, Fire Department employees Lieutenant Jason Moore, paramedic Christopher Torres, and paramedic Elgin Myers were injured and transported to Orlando Regional Medical Center. Thankfully, they were released within 24 hours of the incident. We'd like to express our gratitude to these employees and our sincere sympathy to the Zagowski family. It's always troubling to mourn a lost co-worker, and here in Seminole County, we are a small enough county that fortunately we know a great deal of our employees, and we are more of a family many times than we are a government. So it's important that our thoughts and prayers are with that young family and those young children and that young wife as they try to move forward in life. So with that said, Commissioner Lockhart, we'll ask you to read the proclamation today. We have Sally Harrison, chapter of the National Society of Daughters of the American Revolution, Honorary Regent Jackie Davis is with us this morning to accept the Constitution Week proclamation. Commissioner Lockhart, thank you.
Mr. Chairman and Commissioner Lockhart, before we do that, is it appropriate that we let people know that there is a GoFundMe page for the family?
Sure, yes.
Because I do believe that it's being established by our environmental services, and there is it's a very difficult name to spell. So if I don't know if we can put it up, but the last name is SAJKOWSKI Memorial Fund, and there is a GoFundMe page, and anybody that feels that they want to do that or feels moved, please feel free to do that.
Absolutely.
Thank you for your kind words,
Thank you,
Mr. Chairman,
Commissioner
and
Constant.
everybody.
Thank you very much. Okay, Commissioner Lockhart?
So, fellow board members, I'd like to move the following proclamation. Whereas on September 17th, 1787, the United States Constitution was signed by 39 brave men, and whereas the United States Constitution defined 2 axioms for our nation, the first for basic human equality, and the second for a right to life, liberty, and the pursuit of happiness. And whereas the United States Constitution stands as a testament to the tenacity of Americans throughout history to maintain their liberties, freedoms, and inalienable rights. And whereas, through all of its changes, the Constitution's foundation has endured and adapted. And whereas, this year marks the 233rd anniversary of the drafting of the United States Constitution, and whereas the purpose of Constitution Week is to emphasize citizens' responsibilities for protecting and defending the Constitution and to encourage the study of historical events which led to the framing of the Constitution in September of 1787. And whereas it is the privilege and duty of the American people to commemorate the anniversary of the drafting of the United States Constitution with appropriate ceremonies and activities. And whereas it is now therefore be it proclaimed that the Seminole County Board of County Commissioners does hereby honor the 233rd anniversary of the signing of the United States Constitution and proclaims the week of September 17th through 23rd, 2020, Constitution Week in Seminole County, adopted this 8th day of September 2020.
Second. All right, we'll take a roll call since we have people joining us in Zoom. Commissioner Lockhart?
Aye.
Commissioner Delary?
Aye.
Commissioner Constantine?
Aye.
Commissioner Zembauer, aye. Note that Commissioner Carey is absent, unfortunately. Thank you very much, Commissioner Lockhart. If we would be so inclined to join Jackie on the floor so you can give the presentation, please don your mask for
I would love
pictures.
to. So as a member of the Sally Harrison chapter of the National Society Daughters of the American Revolution, I happen to know Jackie as our regent. And if you have a few things that you would like to say, that would be great. And then we can go down
Please.
and do a picture.
I think you mostly said it. Good morning to everyone, and thank you for the proclamation. And my name is Jackie Davis. I'm the honorary regent of the Sally Harrison chapter. I have with me Mary Ann Kingston, who is now our librarian. And I think Dwight Eisenhower signed the proclamation in 1956 into law. And this year we are conducting at Crooms Academy of Informal Technology, Informational Technology, a workshop with some of the county speakers and state speakers and across the city for the Crooms students to realize these goals that you've named. So on Thursday, September 17th, we will be ringing bells at the museum at 4 o'clock. This is done all across America, and we take part in that every year. So bring your mask, bring your bell, and come out.
Wonderful.
Thank you very much.
Thank you very
ma'am.
much. All right.
And their programs that they do with Constitutional Week at the high schools are always great.
So I'll put in a plug for DAR. For those of you who don't know, it's a lineage society, and anyone who thinks that they may be a direct descendant from an American patriot who fought or gave aid in the American Revolutionary War in their fight for independence against Great Britain, we'd love to have you join us as a guest and see if we can't get you to join. We do a lot of good work, a lot of education with students. So that's my shameless plug.
Thank you, Commissioner
It's a
Lockhart.
good one.
Thank you.
Thank you all for being here.
Cards out front. Thanks for having me.
Be well.
Bye, guys.
Okay, next up, we're going to have Mr. Alan Harris, Emergency Management Director. Also here today with him is Dr. Todd Husty, who is our Medical Director, as well as Ms. Donna Walsh from the Florida Department of Health. They're going to give us an update on the COVID front. We appreciate y'all being here today. Mr. Harris, microphone's yours.
All right, thank you, Chairman, Commissioners, County Manager, County Attorney, and those in the audience. I'm going to pull up the PowerPoint presentation here. Brian is, thank you. Appreciate it. All right, it is day 176 in the Emergency Operations Center in response to COVID-19. A lot of things have been going on inside of the EOC. I'm going to give you a quick snapshot of our statistics up to today. We have today, this morning, we started the EOC. 26,903 calls have come into the Citizens Information Hotline since the beginning of the activation. Our Citizens Information Hotline is currently open Monday through Friday from 8 to 5, 407-665-0000, which is also the county switchboard. But this is actually 26,903 calls specific to COVID-19, so responses to questions related to COVID-19. In addition to that, they of course handle the day-to-day switchboard operations as well, since it's an all-in-one call center. We have given out over 645,000 procedural masks, 276,000 reusable cloth masks at our pop-up test sites and through businesses and other venues. Over 447,000 medical gloves, 30,000 face shields, 185,000 isolation gowns, hand sanitizer, personal protective equipment, and food boxes. So the food boxes are for individuals that are isolated and quarantined in their home, either because they are monitoring cases, PUI, persons under investigation, or they have COVID-19 and they're isolated and quarantined inside of their home. Anyone that needs assistance, we call them every day to check on them, to make sure that they're okay while they're isolated and quarantined in the home, as best we can. When our threshold is met, then we call them every other day. If it gets even more, which after the Memorial Day holiday, we were calling them every 3 to 4 days, or maybe even once a week. So we may only talk to them twice during a spike before they're off of isolation and quarantine. To date, we've responded to over 571 media inquiries. We produced over 70 public service announcements, Facebook Lives, and that's not only response to COVID, but that's personal protective equipment, how to wear masks, CARES, how to apply for CARES assistance, things like that. And we have produced over 250 social media posts on 5 different platforms. Over the last 2 weeks since I was with you last, the governor has signed the executive order extending the state of emergency for the state of Florida. The state surgeon general also extended the declaration of public health emergency. Both of those were done last week. The governor also signed an executive order extending foreclosures and eviction, the moratorium on those, to help individuals throughout our community. Another Florida executive order was signed. This was actually by Jared Moskowitz, the Florida Director of Emergency Management, and this was on ALF and nursing home visitation, so individuals be able to visit persons inside of ALFs and nursing homes. And because of that, there was a critical need for personal protective equipment, so last week we pushed out gloves and face masks, things like that, for individuals that would be going to those facilities. In addition, last week, we were notified that Health and Human Services is pushing facial masks to schools, as well as Visit Florida is going to be doing a large campaign to encourage in-state travel. And this is because we've identified through visitation, through tourism, that a lot of people are choosing the car route for travel instead of the air route. So they're trying to encourage Floridians to do a staycation, stay in Florida, drive to maybe Seminole County to enjoy Florida's natural choice instead of going somewhere else outside of state. I just want to briefly go over this again because there seems to continue to be confusion about this in the public. So Florida statute establishes, of course, the county, and I know you know this, but that establishes that every county has to have an emergency management agency. You've established the Office of Emergency Management under the County Manager's Office. Florida statute also gives authority to the counties to have local states of emergency, which must be renewed every 7 days. And that is renewed by the chairman of the Board of County Commissioners. It also directs that there is a director of emergency management for each county. In Seminole County, we have Seminole County Code Chapter 72, which identifies the chief administrator of emergency management, the position I currently have as the director of emergency management, to meet Florida statute. As part of that code, it gives the chief administrator of emergency management authority to sign executive orders after a local state emergency is signed. And then it also gives access to procurements and agreements and things like that necessary to respond to whatever the disaster is. This is not done in a vacuum. This is done in consult with lots of different individuals. We have an executive advisory board, which advises the director of emergency management under Florida Statute 252 how to move forward. Individuals that sit on this advisory group is the chairman of the board, of course, the 7 city managers, county attorney, county fire chief, county manager, county medical director, the 2 deputy county managers, the Department of Health director, the sheriff, the superintendent of schools, and then subject matter experts. So subject matter experts for a hurricane, of course, would be the Southeast River Forecast Center, the National Hurricane Center, the National Weather Service. The Southeast River Forecast Center will talk about flooding, the river forecast, the National Hurricane Center, the forecast strength of the storm, the forecast track, and then, of course, the National Weather Service, more intricate weather specific to the county. The subject matter experts, obviously, for a wildfire would be the National Forestry, the Florida Forest Service, and, of course, our local fire department. And, of course, for this particular event, it's the county medical director, the director of health, the supervisor for epidemiology, and the 4 chief medical officers of the 4 hospitals in Seminole County. And some of those are on the call today, listening to the board meeting in case there are questions later on. The statistics that we look at whenever we meet, and we meet once a week, is the COVID-19 hospital status. So where is our hospitals at this time? The personal protective equipment levels. So how can we get personal protective equipment to protect our healthcare workers? What's the delays for those, if there are any, which goes also into the hospital statuses. Our positivity rate, the individuals that are testing, what is their positivity rate? The community transmission level. So right now, community transmission is still as substantial, which means that most everybody is getting it from the community. New cases, and Donna Walsh is going to talk about the current cases, new cases, and also the number of fatalities. So those are things that we look at every week when we meet to discuss what executive orders are in place. Do we need to amend them? Do we need to rescind them? Those are the things that we look at. And we look at it every single week. We don't issue any executive orders, any requirements with not the plan in the future to change them, rescind them as soon as possible. We don't want to restrict, we've never. In fact, if you remember Hurricane Irma, we were the first ones to release curfew. We've already released a social distancing order when we went into phase 2. And unfortunately, the repercussions weren't that great. We had a spike of cases in the county, a spike which we couldn't actually handle, over 3,600 active cases at one time. And I'm sorry, the counties are a little bit hard to read here, but during our advisory board, I was asked to look at counties that have mask mandates and counties that don't have mask mandates. And I can make these a little clearer to you too, and I can send them as well. But here's some counties that have mask mandates. I'm going to turn around because it's easier for me to see behind me. So Broward County at the top, you can see once there's a trend that the mask mandate and a trend that things are going better down there. Indian River, same thing. You can see a trend of new cases coming in is less. Now, it's important for anyone that read the news, I think it was last week, right, Don? I think there was a data dump. So that one day, that's what that weird data dump is. That's when Quest dumped a whole bunch of cases throughout the state of Florida, and it just got confusing there for a bit. Orange County, you can see also, once the mask mandate, continuously getting better and better regularly. Pinellas County, same thing. So you can see a trend. Miami-Dade at the top, and then that's us in Seminole County at the bottom. So we looked at other counties that did not have mask mandates. Brevard County, really not much of a drop, just kind of all over the board. Holmes County, same thing. Citrus County, Charlotte County. Now Marion County is very interesting. So we looked at Marion County and we noticed a kind of a hump, and then it started to get better. So they don't have a mask mandate. So we looked at the time frame when that height occurred. We were wondering why that was. So we went to Marion County and we said, well, you don't have a mask mandate. What changed then? And they said, oh, well, that's when the city of Ocala issued their mask mandate. So, and you notice once that happened, it trended better. And then Lake County. So we are doing better. I'm going to ask Donna Walsh to come up. We are doing better in the county. We decided on Friday, the advisory group advised me not to adjust anything at this time. I work for you, so if you decide something different, you can always direct me to do something different. But at this time, they said, because of Labor Day, because of school starting, this just wasn't the right time. Does that mean that we're not going to bring it up this week? No, we are going to bring it up this week. We're going to bring it up next week. We're going to bring it up the following week. We're going to bring it up until a decision is made. But we continue to bring this up all the time. We want to make sure that we are doing what's best for the public to protect them. And also, we don't want to put any enforcement out there, any requirements that aren't necessary. And we believe at this point, it's necessary. This was echoed in a call with all the hospital administrators, as well as our executive advisory group on Friday. So with that, I'm going to turn it over to Donna so that she can give you the numbers.
Thank you, Alan. Ms. Donna Walsh with the Florida Department of Health. Good morning, Donna.
Good morning, Chairman. Good morning, Commissioners. As is often the case when we do press conferences, I provide the status, basically, of the state of Florida as well as our county here in Seminole with the COVID trending and what's happening. So in the state of Florida, as of the last official report, there were 648,269 positive cases reported and unfortunately 11,871 deaths. In Seminole County, we have so far had a total of 8,382 cases reported with 182 deaths, unfortunately. The current active cases out of that 8,382 is 562. And what that means is those are folks who are currently in isolation. They've been diagnosed with laboratory confirmatory test. The hospitalizations over the course of this response have been 594 in total. Currently, we have 47 hospitalizations. That is a marked improvement since when we had the surge that Alan referred to after Memorial Day, and I'll go over some of those numbers in just a moment. Our overall positivity rate in Seminole County is 10.58%. And what this means is the number of tests positive out of those total that were tested. That's over the entire course. Now, if you look at the last couple of weeks, and as Alan mentioned, we monitor this data daily, and we have conversations, and basically what's recommended for the overall health of the community is based on what we're seeing as far as communicability in our communities. So over the last week, we had an average positivity rate of 4.46. The week before, 4.19, and over the last 2 weeks, 4.32%. As Alan mentioned, on August 31st, Quest Laboratories, they reported 75,000 delinquent, if you will, lab reports from April up to the present. And so that bumped us in that one day to 150 case reports, just for that one day. Skewed the data a little bit, no doubt, and the state made adjustments for that. But still, it looks unusual when you see a spike in the middle of trending downward. So that's what that's due to. We also look at what's going on in our long-term care facilities. So we've had a total of 763 cases reported just in our long-term care facilities, and that includes staff as well as residents. We have had, so far in our long-term care facilities, a total of 116 deaths. And so that's basically due to the fact that, as we have said since the beginning, those most vulnerable for complications are those who are elderly and those with underlying health conditions, and that has held true throughout this response. We've had 17 facilities in our community report deaths, and so, we work with these facilities daily, not weekly, daily, calling them either the county, the Emergency Operations Center, in coordination with the health department. And our response with these facilities is that whenever we do receive a report of a positive case, our healthcare acquired infection epidemiologist is on site doing an assessment to assure that all infection control measures are in place, adequate personal protective equipment is provided, and indeed we also call the incident management team, which is a team out of Tallahassee through our governor's office and Department of Health, that comes down and does additional assessments, which they have many times over here in Seminole County as well as other counties, and provides one-on-one training to all of those staff workers in that facility, make sure they understand completely infection control measures. There's also been stood up throughout the state receiving facilities for COVID units, if you will. And this is facilities that are equipped to provide above and beyond care for those who are positive with COVID to make sure it doesn't spread. So we work very closely with these facilities. We've also been following closely our schools since reopening, and schools, as in long-term care facilities, is considered a congregate site. People get together, more likely to be close together. And so whenever you're close together, less than 6 feet, as you've heard many times, this virus can spread. It's spread by respiratory droplet within a 6 feet distance usually. There could be exceptions to that, but that's usually the span of distance that it can travel when someone sneezes or coughs or even talks, sings, whatever creates that respiratory droplet. So in our schools so far, we have not seen evidence of secondary transmission, and what that means is that someone who may have tested positive in the school system, whether a student or a teacher, so far has not spread that virus to others within that setting. That's good news. But we have to remain vigilant with our case investigations and contact tracing to make sure that doesn't happen. And so far, we've had reported over 48 staff and students in public and private and after-school programs in Seminole County who have tested positive, mostly students, and these are community-acquired infections, meaning that, when doing our case investigations, that we determine that they most likely acquired the infection outside of a school setting. So we remain vigilant in that, in those particular situations as well. We have worked very closely with the school district. They've done a phenomenal job putting together a plan to assure that our students, staff, and faculty remain safe, in the school setting. And so they too adopted a mask ordinance, if you will, mask order, to keep everyone safe in the school setting. And so far, it appears that has been very helpful. We have also tested total over 79,200 people here in Seminole County. And so, some of those, that number should be deduplicated, as we call it. Some people may be tested more than once. At the beginning of this response, in order for healthcare workers to return to their jobs, they had to have evidence of 2 negative test results collected 24 hours apart. Through our understanding of this virus and the scientists and researchers from Centers for Disease Control and Protection, National Institutes of Health, and other research institutes, they are now allowing healthcare workers to return optional, either the test-based or symptom-based, which symptom-based is that you resolve your symptoms after a 10-day period of time and can return. So some things have shifted and changed as we learn more about this virus over time.
Mrs. Walsh?
Yes.
I'm sorry, before you move on, I just want to make sure I understood you clearly. You said that 79,200 number had already been deduped, so duplicates had already been removed from that number?
Yes.
Okay.
Yes.
Thank you.
Uh-huh. And so that's almost a 17% of our population here in Seminole County have been tested. We continue to offer testing daily to those who are symptomatic or asymptomatic. We do not restrict testing. In fact, there's a number of free testing areas in the county pretty much daily. Whether at the health department, we're currently testing on Tuesdays and Thursdays from 8:30 to 11 o'clock in the morning. We've seen the demand go down over time, and so we certainly will increase the opportunity for testing if we see that there's more of a demand in the communities. We have also visited communities where we know that there may be difficulty for folks getting to us, whether it's at the health department or anywhere else in the community. So we have actually gone into communities where we know that there's health disparities, barriers to care like transportation and so forth, just to make sure everybody has the opportunity to be tested. For those who are interested in looking at the data that I've gone over today, as well as testing, the Florida Department of Health has a statewide dashboard, floridahealthcovid19.gov, that anybody can access. It looks very similar to the counties, but I know the county puts a few extra elements in there, but anybody can access that data daily. It is compiled with data from the previous day, so 11:59 p.m. the day before will be what is reported by noon the next day. Also, if anyone is interested in registering for testing through the health department, or if you have any questions about COVID, you can call 407-665-3000, option 1. Right now, we are seeing an average of 20 to 50 cases, positive cases reported to us daily here in Seminole County. And just to kind of go back in time a little bit, around the Memorial Day period, in May, actually June 11th, during a press conference, I reported that we had 12 deaths at that time. That's 3 months ago. And we're up to 182 deaths here in Seminole County now. Also on that day, I had reported that our weekly average of cases reported, in April, we had 44, 40, and then in May, 16 for the whole week. 0 to 5 cases reported daily in May. With our stay-at-home guidance, we certainly brought the cases down significantly. 16 the following week in May, the second week, 27 and 27. The week of Memorial Day, May 31st to June 6th, we had 39 cases reported that week. And then the following week, 82 cases. We started to see an uptick in cases as people got together and had opportunity to share this virus. So our positivity rate then was about 2.4%. I know that we can certainly trend in that direction again. We are trending in a very good direction right now. We're just simply not there yet, where we were in May. And until we're able to bring those numbers down, there's opportunity for this virus to spread in our community. So it's only because our community has worked together that we've seen less spread here in Seminole County than many other counties. Especially if you look at South Florida, who honestly has seen an increased number of cases from the beginning of this response. So I thank everybody for their continued efforts to keep this virus from spreading, to protect our most vulnerable in our community, and we'll certainly be available for questions. Thank you.
Thank you, Ms. Walsh. Any questions of Ms. Walsh? Thank you very kindly. Dr. Todd Husty and Clint, do you have any of the hospital's representatives today that desire to weigh in? If you'll get those queued up, please.
Yes, sir.
Dr. Husty?
Very good. Thank you, Chairman Zembauer and Commissioners. Pleasure to be here. I got to know Seminole County government a lot better over the last 3 months, for sure. We've spent lots of time on conference calls, lots of discussion. I am proud of what I know from what you all have done, because we really have taken everybody's concerns into account. As a physician, I was a little bit thrown off when I was placed in that executive committee. And our first meeting, I remember Alan Harris on the phone said, "All right, what are we going to do? Let's hear from medical. Dr. Husty?" And I went, "You do know I'm just an ER doc, right?" And I realized at that point I was going to need to be, I've been doing my reading, I've been doing my studying, I've been on lots of conference calls, but I was going to need to make sure I understood the science behind this. The weird part is that after all of this studying, all of this learning, after talking with experts, the science has not changed. The science is the science. This is not a tricky virus. It is not something unusual. It is a stupid respiratory virus that happens to be fairly deadly. Deadly enough that we need to take heed. It's also a new virus. It's a virus that is so new that we just don't have any immunity to it at all. You throw all that stuff together, and you throw in the fact that we don't like being told what to do, and it's hard for us to accept change. And what have we asked the public to do? We've asked the public to change desperately. I'm 68 years old. It's been hard. It's been really hard. I haven't gone out much. Very, very little. It's hard to be around my grandkids. I've got 3 now, just had a new one. The parents of that new one both have had COVID. I get to hug them. But everybody else, not so much. There's been a lot of distancing that we've all had to suffer through. Why are we doing it? Because it works. It just works. Mass and social distancing work. So I have people from representatives, or we have representatives from each hospital on right now. We had a discussion last Friday. We said, we know the questions coming up about when are we going to get rid of some of this, some of the mask orders, some of the social distancing. What is the end point? And I will tell you that unanimously, the hospital said, don't change anything right now. It's working. There's that old don't fix it if it's not broken routine. Tim Cook, are you on?
Yes, I am.
Good morning, Tim, from Advent
Morning.
Health.
Good
Welcome.
morning. Thank you. I'm not a scientist, and so I'm not going to speak much to the virus other than to indicate we, during the peak, we were between COVID patients and PUIs, patients under investigation. We were pushing the 120 mark in the hospital, and while we did have capacity, that pace at that level really strains the system and our ability to respond appropriately. So I would concur with Dr. Husty. What we've seen, the only thing we've really seen in the science, and there are physicians on who can speak far more better about this than I am, is that really the thing that's changed is the teamwork and behavior of our community residents all kind of pitching in and leaning into this very awkward, difficult time. I've noticed it personally myself in a few restaurants that I've been in and stores. The compliance of masks seems to be significantly better than it was a couple months ago. And it is the single factor that we can all point to, because most of the other science to suggest that the virus is still functioning the way it is, and it will transmit to people who aren't being cautious about it. So yes, as a healthcare team here, we're very pleased with your leadership. encouraging people to comply. It's hard to know when we'll be at a point where we won't be as vulnerable in transmitting, but it will come. But it will be after a time, and so we appreciate your leadership, and we would certainly echo the response of Dr. Husty, Donna Walsh, and Alan in terms of staying the course at this point to continue the safety that we have attained in the county. And again, thank you guys very much, and happy to take any questions. But you do have some physicians on who'd be much better about some of those questions than myself.
Thank you, Tim, very much. Dr. Benoit from Central Florida Regional, are you on?
Welcome, Dr. Benoit, if you're in. And if staff could up the volume just a little bit, it might be helpful in the room.
Can you hear me?
Dr. Benoit?
Yes, can you hear me?
Yeah, we've got an echo. Maybe, is there another computer or something on maybe in your office?
So,
go ahead, Dr. Benoit, let's try it.
Yes, I'm trying to. I apologize, I'm trying to.
Take your time. Dr. Husty, do you have
Sure.
anyone else you want to go to?
Dr. Anita, are you there from South Seminole? Dr. Anita?
Clint, if you bring Dr. Anita in, please.
Good morning, everybody.
Morning.
Can you hear me well?
A little low. The volume's not high enough for us here.
Okay. Is this much better now?
That is somewhat better. Yes, thank you. Welcome.
Thank you.
So, Dr. Anita, could you tell everybody, we had this conversation Friday, and I was overwhelmed with everybody's response. It was without asking for it. It was kind of, we were just sort of discussing in general, and suddenly everybody had a very strong opinion. What is your opinion about what is going on currently, and what should we do different?
Thank you, Dr. Husty. We would like to support the long-term strategies that have been in place, which is keeping the community well. Going back to a few weeks ago, when we had record high number of cases, increased hospital inpatients, and there were many tragic deaths especially of patients who were about 65, 70 years of age. And we have seen the volume of inpatients and the deaths come down over the last few weeks since we have instituted the masking strategy, social distancing, and so on and so forth. So we believe that continuing these strategies will mitigate transmission as we continue to work and play in our community and also moving forward. So we would like to stay the course as we are, as we have seen this work. And as we all know, Dr. Husty, in the medical field, this is a virus. And the virus needs a human host. And as long as we don't provide a human host, we can beat this. So I'm open for any questions. Thank you again for inviting me to be here today. And thank you, Dr. Husty, Donna, and Alan, for all of your leadership in Seminole County.
Thank you very much. Appreciate that.
Just a note, Dr. Anita is from South Seminole Hospital.
Okay, yes, absolutely.
Do you want to bring Dr. Benoit in now?
Pardon?
Want to bring Dr. Benoit in?
Yes, please.
Dr. Benoit, are you still with us, sir?
I'm still with you. Can you hear me?
Yes, much better, please.
Much better.
Thank you so much for that, and I apologize for the technical difficulty from earlier. I'd like to echo my colleagues. We are currently in what is called a level 2 status. At the peak of the pandemic, we are level 3 with no visitation. With level 2, which means we have some visitation, but for us, this represents a sustained transmission that's still within the community that we have to be very careful with. So we're still at universal masking, we're still screening, and we're still watching how the community is responding to all the different holidays that we've had, and we've seen the increases. And the increases that occur in the state of Florida as well as Seminole County is mirrored within all the hospital systems that are on this call currently today. And so not only are we paying attention to our employees, but also to all of the patients who are sick. And as you've seen, many of the numbers have gone up. Ever since the July 1st mandate in Seminole County, I will tell you on a personal scale, many people have reached out to me as I've spoken to different groups about masking and is it truly necessary. And I've mentioned this to the group before. My background, I am Chief Medical Officer here at Central Florida Regional, but I'm also a trauma surgeon, a general surgeon, and I have worn masks for the majority of my adult life. And many of the objections that came up about CO2 retention, carbon dioxide, and oxygen really is all false. The mask is safe and they protect you. As a surgeon, you'd want me wearing a mask when I'm operating, and you want to make sure that there are no infection that carries through. As many of you know, infections get carried by droplets, which is stopped by these masks, which makes them safe and effective, and will help us keep the numbers down. And that's what we want for the community to do as well, is to make sure that they treat their colleagues with that same type of care that we all do in making sure that we wear our masks to protect each other. Thank you very much for this time.
Thank you, Dr. Benoit, very much.
Dr. Benoit from Central Florida Regional and Oviedo, correct?
Correct.
Yes, thank you, Dr. Benoit.
So I wanted to bring up two more things very quickly, two other physicians. One is Dr. John Murray, who is one of our medical directors in EMS in Seminole County. He was sent out early on, like 3 weeks into this, on a DMAT team to San Diego to take care of people from a cruise ship, 500 people. He was the lead physician. He called me up about 3 weeks later and said, Todd, I'm really not supposed to talk with anybody about this because this is kind of like secret, but I got to tell you, this is the real friggin' deal. This is the real deal. He said, I didn't believe it when I came out here. I thought it was all being blown up and blown out of proportion. It was not blown out of proportion, and he knew it. He watched people die. He tried to keep them from dying, and they died anyway. The way they kept everybody from getting was masking and social distancing. It was all they had to work with, and it worked pretty well. They didn't lose everybody, they lost some. The next is Jason Sniffen and his partner Cooper, Dr. Cooper, who are also work with Seminole County. They're part of our needle stick, and it's an infectious disease program that should be award-winning. They're just great at this. They and Dr. Stan Hames put together, if somebody gets exposed, we get them, and it's a significant exposure, a firefighter, we can get them their first antiretrovirals, the drugs that stop HIV if you get it early enough, within an hour, which is, nobody does it that well. So Dr. Sniffen and Cooper, they work at Advent Orlando. And at Advent Orlando, they help run the COVID unit. Have they been impressed by this disease? Oh yeah, they've been impressed. It's scary.
Dr. Husty, not to interrupt you, I think we have a Dr. Sinclair that's trying to get in.
Oh, I'm sorry. Dr. Sinclair at Advent.
Yes, at Advent Health. Clint, if you could bring Dr. Sinclair in. I don't want to hold the doctors up. I know they've got things they've got to get done. Welcome, Dr. Sinclair. You're live.
Thank you, Chairman Zembauer. I just want to echo the comments of my colleagues as well as Tim. During the peak, we had as many as 90 COVID positive patients in-house. And I would say that even today at 25 COVID positive patients in-house, that still exceeds our April peak. So we remain quite cautious in the hospital setting. We also, like Dr. Benoit, use a leveling system, and ours is color-coded with green, yellow, and red. And if we were to look specifically at the COVID occupancy in our units by level of care, we are in that yellow zone. That's in our ICUs, in our progressive care units, and in our medical floors. So we are not in the green. We were previously in the red, and right now we reside in that yellow and remain quite cautious, even though our levels of PPE are where we want them to be, and our staffing has significantly improved. We still, in our COVID units, have a great degree of caution. So I too would join my colleagues and join Dr. Husty, Donna, and Alan in encouraging that we remain and maintain our current level of precaution as it relates to efforts to ensure that our community continues with the behavioral related preventative measures for COVID. Thank you very much.
Thank you, Dr. Sinclair, very much, and Advent Ultima again. So begs the question, what is the end point? When can we change? When can we stop doing this? I think if we had to grade where we are with our management response to how many cases we got when things just went skyrocketing after Memorial Day, it got out of control. We were definitely out of control. We could not follow up. You heard Donna and Alan refer to that, and especially Donna and the health department trying to keep up with the cases. We could not keep up with all the cases, not the way we wanted to. It was unmanageable. So when I look at, I mean, obviously I have an opinion, but it's not just my opinion. I do listen to everybody. And I think if we had to say, what level are we at? We're in yellow. We're at level 2 right now still. We need to be at level 1 before we decide to do anything different. And what is that? That's when we can manage the cases, every single one of them, when we can provide meals to people who can't get out to get their own food, when we can do this for everybody that has this and know where it is and know that the community spread is being managed. And that's probably, I've tried to get a number from everybody, it's so new, nobody has a number. It's around 50 cases, somewhere around there. We were there before. We were absolutely there before. So it's doable. Right now, if you've heard from everybody, right now is not the right time. We are still, this virus, we've given it the opportunity to spread, and it spreads. Got to stop the opportunity, got to keep doing what we're doing, and don't fix it if it's not broken. Thank you for your time. I know I'm long-winded.
Thank you, Dr. Husty. Any questions for Dr. Husty from the board?
I do have some questions,
Commissioner
but I don't know
Lockhart.
if they're best directed to Dr. Husty or to Mr. Harris. Do you want
Okay.
to wait till the end? Are we at the end?
Why don't we go ahead and try to move this through? You want to move this through now while they're here?
Yeah, I think
Okay,
that-
Alan, you want to come down to stage for questions from the commission? Commissioner Lockhart is recognized, and who, or do you want to address?
Well, I'll give it to Alan, and then Alan, if you'd like to punt.
Sure.
I'll leave that to you.
Okay.
Every year, I'll look to you for the number of years, but we approve a comprehensive emergency management plan. And how often do we do that?
Every 4 years we update it.
Every 4 years. And did we just do it recently?
We're actually we're in the process. We just started it Friday? We just started our preliminary to do next year.
Okay. As a part of that comprehensive emergency management plan that this board approves, are there pandemic guidelines?
There's a
that are-
pandemic annex.
And since I wasn't here when it was approved, although I've seen it, I wasn't a part of that approval process. Did you use a disease as a template for drafting that plan for the pandemic?
So that's an excellent
element?
question. So each year we do an exercise related to a pandemic. So over the last few years, we try to choose the virus that is well known in the community. We never call it the virus, but it's XYZ virus. And then, so it was Ebola, Zika, H1N1, swine flu, all the ones we've dealt with, we've had exercises related to that. Unfortunately, the pandemic exercise, the pandemic annex, is written on the pandemics we know about. COVID is different. We're learning something about, every day something new comes out, new guidance. They've learned something new. And it can kind of get confusing. So yes, holistically, we have a pandemic annex. Yes, we've been following it. But there's been a lot of anomalies in COVID that aren't true in Ebola. We kind of know what Ebola is going to do. We even kind of know what Zika is going to do. But with this one, asymptomatic people running around and spreading the virus, that wasn't something that was part of the plan because that wasn't really thought that that would happen. So there are some anomalies. We are right now in the process of readdressing our pod plan, our points of dispensing, because as a vaccine comes available, we're going to have vaccine clinics. We've done it to some level in H1N1 and swine flu. We've had those. We had the flu clinics, the flu shots, those kind of things. We'll be establishing those again. So that's also in that annex as well.
Okay. So were widespread use of masks contemplated in that annex?
It's a portion of it.
Okay.
Well, I don't know if you want to address that at all, but there is a part of that. But yes, I mean each virus is going to be slightly different.
Right.
So social distancing, protective measures are all listed in there.
Okay. I guess, the thing that I am, and this is going to sound heartless. So
Go ahead,
I'm gonna
Commissioner
own it.
Lockhart.
But people get sick from a variety of things, and tragically people will die from a variety of communicable diseases. My biggest concern throughout this event has been the pressure on our hospital system. And frankly, I looked at our hospitalization rates, and I talked to some of the folks who were actually on the Zoom with us this morning at different times during this event to ask them, what's happening for you from your perspective. And so I kind of looked to them a little bit more and looked to the hospitalizations more than I looked at even at cases. That's just me. That's my personal barometer. But more and more, as people started asking, what are your benchmarks for rescinding the masks? I put my school board member hat back on. And when we talk about benchmarks in the education field, it's after we have a norm. And then you can go back in and you can set your benchmarks based on the norms. And this doesn't have a norm. We don't know exactly how to set benchmarks for this. So hearing Dr. Husty say 50, that's the first time I've heard a number. And so I want to explore that a little more if we could.
Sure.
Where is that number coming from? What does it relate to? How did we come to it?
Yeah. Can I say one thing? I did press these two over the weekend, knowing that we're going to be here this morning. I pressed them. Can we come up with a number? And it's based on our resources. It's based on the hospitals, when the impact that we see happening, and then the concern that it can still grow, because we were at less than 50 before Memorial Day, and we were off the charts 2 weeks later. So if you ask the hospitals, they were fine at Memorial Day, and 2 weeks later, they were getting slammed. So I asked them their resources, and what do we need to have in the community as resources. Donna.
Ms. Walsh?
Commissioner Walker, I appreciate the question, and we did an extensive research across the nation to see if we could find a metrics, and you're exactly correct. This is new. The only defense we currently have due to a lack of vaccine is non-pharmaceutical interventions, and that's perhaps the difference between H1N1, that is a flu virus, and we did develop in this country vaccine within 5 months, versus a coronavirus with this particular strain that we've never encountered before, globally. So there's a lot of unknowns there. What we did discover is 3 different states had a metrics for return to school with mask. And it was, if you had 10 cases per 100,000 population for the week. So in Seminole County, that would be about 47, 48 cases for the week. We're getting between 20 and 50 cases reported daily right now. So that was the metrics you can look at.
Okay.
If you also look at what just came out from HHS, Health and Human Services, for testing in long-term care facilities, nursing homes and others, they're using a positivity rate. So less than 5% positivity rate, you can test once a month. If you have 5 to 10% positivity rate in your community, you test every other week. If you have more than 10%, you're testing weekly. So those are the metrics that are currently available out there with the science that's known about this virus at this moment. I hope that helps.
It does. Thank you.
Any other inquiries of this group from the commission?
I have more, but I wasn't going to hog the floor.
Well, I would just say, and please do, Commissioner Lockhart, many of us sit on regional boards throughout the region, so we have a capability to interact with other people throughout not only the Central Florida region, but many times the entire state. I know Commissioner Constantine sits on FAC, so he's interacting with all 67 counties throughout the state. Commissioner Delary and myself sit on Metro Plan Orlando, so we're having discussions with other individuals. We also have a health call every week throughout the region, which includes Osceola, Orange, Lake County, Seminole County, to discuss what's really going on. What are they seeing? Those are the hospitals on the call. They are experts in epidemiology. They are the emergency management people. They are the fire people, all these individuals. And I can tell you that this has been very eye-opening to me. Never did I ever believe that I would become the chairman of the Board of County Commission in the first time that there would be a pandemic in the state of Florida in our lifetime. It's been very challenging. The three that are standing here will tell you I've been very damn vocal in these meetings. I've challenged them. I've asked them to prove up. And I will tell you I support exactly what our team has done. They take that challenge, they prove it up, they show us, they have that conversation, they bring the experts in. Exactly what I would want for our community to have that vetting done. And I think Dr. Husty said in this case, and I think we all understand, and I've said many times in press conferences, is there's a lot of things we don't know about this, and that's what's so hard. So when these individuals are tasked for protecting the health and welfare of almost 500,000 people, I think wearing a mask and erring on the side of caution is a small responsibility that we're able to incur for a period of time. You know, it was very important to note Seminole County never shut down a single business. That was very paramount to not impact the economy any further than we absolutely needed to. We know there's a lot of talk out there about, well, the county did this, county did this. No, the county did not shut down any businesses. All business shutdowns were mandated either federally or state. We've always tried to migrate through those to give capacity to our businesses to allow them to operate. I think that's clear, but I absolutely support what this team has done. I know it's tough. I know Mr. Harris, as well as the EOC, has now been in session over there for over half a year. And it's tolling and taxing on them. They have to take a lot of abuse sometimes from the public who either just doesn't understand or doesn't want to understand, or they want to make a political statement. I will assure you that has not been the case with this group. And with the 7 cities and all those people that are on these calls, there's a lot of input. I mean, there truly is. So I would say thank you to the emergency management team. Thank you to the public, our small businesses. We're all part of this. We're all in this together. These are the people in the community that continue to help us slow the spread so we can get to a point where hopefully we get to a vaccine and some normalcy. But so that's all I have for y'all. Commissioner Lockhart, more investigation, inquiries, please.
Our team has really, truly been amazing, and they have fielded a lot of phone calls and emails and text messages for me and asking all sorts of questions about trying to help confirm or deny rumors, and it's been challenging, certainly, for everyone. It has been disheartening to me how much this event has divided our community and pitted otherwise very well-meaning, good people against one another. It's been very, very hard to watch. But I brought up something a few meetings ago, and I referred to the response that I got as crickets, but I'm going to do it again. I think it is imperative, and I think our community deserves at some point in time for this board to readdress our policies in regard to pandemic public health type emergency crises. a flashpoint is never the right time to do it. I'm not suggesting we do it now, but I think some of the angst and anxiety that I'm sensing from our community is because they don't know any more than we know, frankly, what the rules of this game are. And you know, it's easier to hold it's easier to hold us accountable when they know what it is that the end game is. Where are we going? When do we win? You know, every sport, every game we play, we know what it is when you win, and this we don't know. And so if there is an opportunity for us as a board, maybe it's after we get to green, to commit to sitting down to workshopping with our professionals how we could look at this from a policy perspective moving forward. I think our community deserves it. And we may decide after we hash it all out and we lay it all on the table that we don't change very much, but we continue to operate with the plan we have in place now, with acknowledging that this is changing all the time. And I feel very adamant that our community deserves to know that this board is going to commit to addressing this topic for the future. So I did it again.
Well, I have no problem having the discussion.
Mr. Chairman?
I think that many of us want answers about a lot of things on COVID. We would all like it to be over. We would all like it to come to an end. We would all like for the pharmaceutical people to have a vaccine tomorrow and say, you know what, we got the silver bullet. Everybody goes back to normal. I have no problem having the conversation at some point. I would support that 100%. But that said, I have a core value belief that a politician should not be making decisions for the health and welfare of the people without inquiring and having those matter experts weigh in. We've seen it across this country, quite frankly. I won't debate that for 1 second. We've seen the mess from coast to coast. I think our governor is about to weigh in on some of those issues, and that may be as soon as next couple of weeks, but we'll have to see. Commissioner DeLaurie?
Thank you, Mr. Chairman. Question is for Alan. Mr. Harris? I know we have to update our emergency management plan every so many years. You stated that. What's the actual process and the timeline for that? Because I think that would be the appropriate time to do something. Can you walk us through that process?
Sure. So we just started the process last week. So it includes reviewing every one of the annexes. So there are groups that are pulled together to look at each annex. For example, our terrorism annex, we obviously have the Sheriff's Office, the Joint Terrorism Task Force, Urban Area Security Initiative, Regional Domestic Security Task Force. All of those look at each annex. So with the pandemic, it'll be the hospital systems. Of course, the Florida Department of Health really is the lead for the rewrite of the pandemic annex, as well as epidemiology. And so we bring all those folks together to look at each chapter. And then each section of the CEMP, and is broken down into 18 different emergency support functions. There are leads for each one of those emergency support functions, so I'll take an easy one. Fire, as I see the fire chief over there. So clearly the fire department is the lead for fire response, but we bring in the Florida Forest Service, all the municipal fire departments, anyone that would respond to a fire in our community, and then we review that particular annex. So there are 18 different emergency support functions. All 18 are reviewed, and that'll be done over the next 4 or 5 months, probably a little longer than that with COVID. And then it'll be brought, a draft will be produced. The draft goes to the state of Florida. The state of Florida reviews it to make sure that it meets all the criteria in statute and all the criteria in the crosswalk. It's brought back here. Any adjustments that are needed, we'll make those adjustments. And then we bring it before you for adoption.
Alan, so you're saying within the next 6 months, that'll be going up to the state, correct?
I'm sorry?
Within the next 6 months, it'll be going to the state of Florida.
Yeah, it'll be probably be a little longer than that just because of COVID. But yes,
Plus
it's
or
not
minus.
due until the end of next year, but Seminole's always early. So technically, we really didn't need to start the process for a couple months, but COVID, so we're going to go ahead and begin.
So there'll be some time, there'll be a window during that whole process that we actually get input from the public and also the board?
Sure, plenty from, yes.
Okay. I think that'd be an appropriate time to
Yep,
actually look at it.
absolutely. In fact, we can, we can even set up a work session if you want. Sure.
I think it'd
that'd be great.
appropriate.
Is there support for a work
Mr. Chairman,
session?
I think it'd be appropriate,
Board?
once we hear from the local folks, to actually hear an update to us, as well as the public, so we can actually understand exactly what changes are being made.
Certainly.
If we could do a workshop, Mr. Chairman, I think that'd be
Sure.
appropriate.
Ms. Guillet, are you on point with that?
Sure.
I understand the board would like a workshop on this matter?
Yes, sir.
Thank you. Anything from the county attorney on this issue?
Just to compliment Alan, sitting in on those meetings and listening to the advice he gets, he's doing an incredible job. And just to note that every single court in the state of Florida that has heard a challenge to a mask order has literally thrown every one of those out. So, you know, the challenges are there, but being Constitutional Law Week, I can tell you that from the Federalist Papers down to liberal Supreme Court justices throughout American history have said that the primary responsibility of government is to protect the health, safety, and welfare of citizens. And even liberal Supreme Court justices have ruled that in times of national emergency, the government sometimes need to take those necessary actions to protect the citizens' health. And Alan and his staff have done an amazing job, as far as I'm concerned, from the legal side.
Thank you, County Attorney. All right, nothing else. We appreciate y'all being here today. We don't hold you up any further to get back to our community's health. Thank you very kindly. All right, next matter up is our CARES update. Ms. Nicole Guillet, our county manager, is going to give us an update on that.
And Chairman, I'm happy to do that now. It just has to a note about timing. I don't know if you are planning on doing a break. We do have 2 work sessions, and I know we have some people here for at least one of the work sessions. So I'm happy to do my presentation now, or it can wait until later. if
Okay.
that's-
No, that'd be fine. I know we have some people here to give presentations for one of the work sessions that we may not want to hold up. So, pleasure of the board, is that okay? Okay, let's take 5 minutes. Let's be back here at 5 after 11. We'll be in breaks. Session, we do have a quorum. Hopefully Commissioner Constantine will find his way back soon. With that said, the next item up is Ms. Guillet has the consent agenda for our county manager's consent agenda. Do you have any additions or deletions, county manager?
No, sir.
Okay, pursuant to Florida law, the public has a right to be heard on all propositions except when the Board of County Commissioners is acting on ministerial or emergency matters or conducting a meeting exempt from Section 286.011 Florida statutes. Public comment time on propositions shall be limited to 3 minutes for individuals and 6 minutes for a legally recognized and registered group of representatives. The right to be heard during quasi-judicial hearings is governed by Florida law. The public will be provided the opportunity to be heard on non-agenda matters at the end of the meeting. Proper decorum shall be observed. If members of the public would like to make a comment or attending the meeting in person, you'll be called on first. If using a computer, iPad, or other electronic devices, click on Raise the Hand feature and you'll be called on next. Lastly, if you've called in on a telephone, you can raise your hand by pressing *9. You'll be called on in the order that you've raised your hand. Do we have anyone from the public that wishes to address consent items 2 through 7? Consent items 2 through 7. I have none in written request. Clint, do we have anyone that desires to speak on consent items 2 through 7?
No, sir.
Okay. Is there anyone here in the audience that may have forgotten to fill out that wants to speak about items 2 through 7? Seeing none, I'll move to the board for...
Mr. Chairman, make the motion to approve consent items number 2 through 7.
Second.
We have a motion and a second. I'll call roll. Commissioner Lockhart?
Aye.
Commissioner Delory?
Aye.
Commissioner Constantine?
Yes.
Commissioner Zembauer? Yes. Very good. Ms. County Manager, items 2 through 7 are accepted and passed. Next item up, we have the county manager has a couple of action items that need to be brought forward. Ms. Gay?
I have 2 quick items for you that really are, or one is an action item, one is more of a discussion item that you may want to take action on. The first item is I just need authorization from the board to delegate signatory authority to Tricia Johnson on the small business grant applications so that we don't have to run them all through the chairman's office. So if nobody has any objection to that, I would appreciate a
Move to approve the
formalization on that.
request, Mr. Chairman.
Second.
Move second. Any further discussion? Seeing none, I'll call roll. Commissioner Lockhart?
Aye.
Commissioner Delory?
Aye.
Commissioner Constantine?
Yes.
Commissioner Zembauer, yes. Okay, Ms. Gay?
The other item I have for you, I don't know that it requires formal action by the board, but I wanted to bring it up during the meeting portion as opposed to the work session portion. As you are all aware, in early August, the president issued an executive order allowing for the deferral of certain payroll taxes for employees making under $104,000 a year. Although he issued that, signed that executive order a month ago, the guidance on it didn't come out until about a week and a half ago. And so we've been trying to understand how all of that works and whether or not we should opt in or opt out. Under the guidance, what gets deferred under that program is a Social Security tax, which is about 6.2% is withheld from every employee's paycheck. Would be withheld between September 1 and the end of the year. Under the guidance, although it would be deferred during that period of time, it has to be paid back. It has to actually be paid between January and April of next year. And the county would be responsible for remitting that money. We would be the ones that are on the hook for collecting it. So we've talked about it internally, and our recommendation is that we opt out. We've talked to other local governments. Everybody's sort of been trying to figure it out since the guidance came out. And we've talked with the sheriff's office, the school board, other large governmental agencies here in the county who are also trying to sort of look to us as to what we're going to do. Surrounding counties, most of the cities are opting out of it. So unless there's an objection from the board, that's the course we'd like to take, is to just not take advantage of that deferral, because our employees will be required between January and April of next year to pay it back. And we'll actually be the ones that are responsible for collecting it. So if somebody leaves during that time period, it's the county that's on the hook for that. So as I said, unless there's an objection, that's the direction we're going to go.
Comments from the board? I have no objection to letting staff handle that at the staff level.
No objection.
Commissioner Lockhart?
I think it makes sense. Right, thank you. That's all I've got for you this morning.
All right, with that, we'll move to our next item, which is going to be public participation items for future agenda. Let's start with the commission. Anything that you want for future agendas other than what we've already spoke about Commissioner Lockhart brought up? Seeing none? All right. Clint, if you would cue anyone that is on the phone, we're going to go to those who are present first for public input on open matters. It looks like we have a Kelly Shilson. Ms. Shilson, if you would approach the podium, state your name and your legal address for the record, please. You will have 3 minutes.
Am I allowed to take this off?
Yes, please. We're at the podium so we can understand you.
All right, my name is Kelly Shilson. I live at 224 Slate Drive, Longwood, Florida, 32750. Thank you for taking the time to listen to me, my concerns today. I'm going to go as fast as I can. I'm here to discuss the coronavirus executive order mask mandate. It is understandable that an executive order may be necessary during a surprise healthcare crisis and an act of nature. However, we suggest it is now time for the commissioners to decide what is right for our county, as you are the ones we elect. To be clear, my purpose here today is not from a position of convenience or imposition. It is to address mental, emotional, financial, and yes, physical health. The mask mandate was put in place to flatten the curve, along with the rest of the country, as Seminole County was feared to be having a spike. In reviewing the virus's actual case mortality numbers, this is what I have concluded as of today. We have 470,000 total population. Out of that, 79,000 have been tested for COVID. From those tested, 8,200 have tested positive. That is a 1.7% infection rate. Out of those infected, 2.1% have died, or 175 people. To put it another way, it is 0.036% mortality rate. Out of those who died, 116 were from long-term care facilities. That leaves 63 people in the general population in Seminole County out of a population of 470. It's 470,000. If you follow the guidelines of the CDC, 6% of the fatalities were COVID only, which in our county would be 10 people who died that did not have comorbidities associated with the virus. Who is adding input on what the mask mandate is doing to our children's psychological health? Does it facilitate depression? What about kids with speech and hearing disabilities or spectrum disorders? How are suicides, substance abuse, spousal, and child abuse statistics being weighed in on this discussion? This may not seem apparent, but it is a tertiary effect. Elderly depression from isolation is a topic for a different day. I would urgently request you to consider what this mask mandate is doing to the people of our county, and I would like it to convey what my concerns are. Regarding our children, this mask mandate is instilling fear and antisocial behavior into them. Children need to see the faces of their parents and teachers to see expressions, smiles, and humanity. They are falling behind in learning, and a stellar public education is one of the prime reasons people move to Seminole County. Family-owned businesses are closing every day for good in Seminole County. We need to reverse that. We all need each other to thrive, and that includes people on the public payroll. Without us, there is no you. Servers and retailers who make substantially less now are probably the ones hurt the most. After the people that have lost everything, that is. The mask mandate has all but eliminated our leisure activities in the county because who wants the hassle? Not to mention people shaming you for not wearing a mask. If you want Seminole County to flourish economically, it is time to open up our economy and unmask. We just recently went to 2 neighboring counties with no mask mandate. Our servers stated they are busier than they have ever been at this time of the year, and it is specifically because people are escaping the mask mandates in their own communities.
Ms. Shilson, if you could try to wrap it up, we're 3.5 in.
I have half a page, sorry.
Go ahead.
Does the panel of professionals advising in this mask mandate also include child psychologists, business professionals, tax receipt managers, financial managers, and senior citizen mental health professionals? It is troubling to discover there has never been an exit strategy for this mask mandate. When the executive order was implemented, the next goal should have been a plan to rescind it and restore our civil liberties. With our civil liberties comes our financial and mental and tax health. For the 10 people in Seminole County that have died strictly of the coronavirus and the other 162 that have died with a trace of it in their system, we are masking 470,000 people and severely damaging vital interests in our community. The fear is overwhelming for so many, but does not seem warranted based on the actual numbers. How do you know the mandate
Ms.
is
Shilson,
not
we're
doing
4.5 in.
more harm than good?
We've given you a lot
I'm
of
literally at
latitude.
the end.
I think we get the point.
All right, everybody had a lot of time to talk about this today, and it's a shame.
Thank you, ma'am. We appreciate your input. Next individual, and forgive me the writing of the last name, it looks like Barbara, and I'm going to say Denny.
Hello, I'm Barb Deeney. My address is 21856 Dairy Road, and I'm actually in Eustis, Florida. However, I work in Seminole County in Longwood, and Kelly is actually my niece, so I do have a lot of family in Seminole County. So I'm going to finish
Welcome.
the rest. Hi.
Go right ahead.
So I'll actually finish her summary. In summary, we are saying that we are trying to protect less than 0.5% of the population by negatively impacting the other 99.5% of your residents, and many of them irreversibly. Many people have messaged me, messaged Kelly privately, that even though they supported the mandate at the beginning, they now believe it has unnecessarily continued on for far long. They're fearful of expressing their opinion for fear of being shamed and canceled, even from their own family. These decisions will demonstrably show up in the tax receipts, and this is the sort of thing the silence of the majority will come together on the voter booth. At the end of the day, it should be our right to wear a mask or not, if we choose. If I feel I'm at risk, and I am at risk of endangering someone else, it should be also the choice to wear a mask or stay home for the people who feel that they're endangered. We can protect those citizens most vulnerable quite easily, as you and the governor have proven. One of the things that I would like to add personally, more and more men in particular are wearing these over, above their noses and close to their eyes. And as a woman going out in various places, it's very unnerving. God forbid there's something that happens and the police need to identify these people. They're not allowed to identify them. How are they going to do that? So I'm here in Seminole County quite often, and I would like for that to even be thought about as far as protecting the citizens that live here and visit here in the county. But thank you.
Thank you, Ms. Taney. Okay, Clint, do we have anyone on the electronic Zoom portion on the phone?
Yes, sir.
Okay, if you would bring them in, please. Okay, looks like Miss Deanna Denin. If you would state your full name and address for the record and a brief synopsis of what the matter is about. You have 3 minutes, ma'am.
Hi, Diana Dannon, 938 East Palm Valley Drive. You guys voted at the last commissioners meeting. You passed a motion regarding a Legacy 240 proposal, and I've sent you ad nauseum emails on this, but I wanted to make sure that I made part of the public record that the motion that was proposed, Commissioner Carey referenced an email that was sent to the development staff, and the proposal that I believe you wanted to pass was for 4 stories, 45 feet, and the email that Commissioner Carey referenced in her motion stated 5 stories. It had not been corrected to 4 stories. So I'm asking the commission, because of that conflict, to rescind the motion that they passed on August 25th, bring that entire proposal back through the development process because it was never properly vetted, and bring it back forward for public comment. I would also like to ask the county commission why in the land development process, they do not vet the developers for being current on Seminole County tax. JEL Land Development is delinquent on Seminole County tax on 3 separate properties.
Ma'am, we're not going to sit and listen to allegations made about members of our community. If you've got a topic, be very direct to the points in the matter, but we're
Okay.
not going to listen about
For any
disparaging
development,
individuals in our community.
For any person submitting a development proposal, if we're going to consider giving them the consideration of a rezoning or a setback waiver, we should at least ensure that they are paying their taxes in a timely manner.
Ma'am, I'm not going to warn you again. We're going to have to eliminate your call. Please do not make disparaging comments about people in our community. If you've got a topic or a
It's
specific
public
point,
record,
address that
sir.
point.
I'm speaking on a public record, I'm not making something that isn't documented. Okay,
You have 30 seconds, ma'am.
I'll move on from that. I've made my point. And I'm going to continue to make my point regarding that development as it relates to Hometown America. I would just like to say that I read in the New Yorker that schools in China, just hear me out for a second, have a tracing application on the student's telephone, and they turn on their Bluetooth, and they're able, the application reads whoever that student comes in contact with, it registers that other person's phone number on that application. And so if a student or a teacher comes down with COVID-19, they're able to take the telephone of that student and pull up the phone numbers of all the people that for contact tracing.
Ma'am, you're
Now-
30 seconds into your, 30 seconds beyond your maximum. Please wrap it up.
I know we can't dictate that in America, we're a democracy, but it might be an application that our school boards might want to make available to all school students and teachers for contract tracing to control COVID-19 outbreak.
Yes, ma'am. Thank you very much. Appreciate your input.
May I ask a question?
Ma'am, we're out of time.
I know, but it's a question.
4 minutes.
How do I propose questions publicly to the board that the board would have to respond
If it's
to?
on an agenda matter or a future item for the agenda, or if it's something specific, it would be to our staff. So whatever type of question we've directed our staff, I'll ask our county manager to reach out to you. Would you reach out to this resident and see what kind of questions she may have, Ms. Guillet? And see if we can help her with the information she needs? Thank you very much, and be well.
Mr. Chair?
Clint?
I'm sorry, before we go on to that, I did have one question on what you said, I voted against that proposal, but my question is, specific to her request was, what was transmitted was 4 stories, 5 stories. It was my understanding that we were approving a 4-story project, so I'm asking this of our county attorney.
Well, I'll yield to the development services, but my point is that Ms. Dane has said that she plans to file a lawsuit concerning your actions, so I would ask that we don't comment any further at this point.
Understood.
I can clarify that your action was based on a draft development order and not an email.
I couldn't hear you, I'm sorry.
The action that the board took was based on the draft development order that you had in front of you that day and not on an email, just so you know that
Right, there was,
you weren't acting on
like
it.
what she's saying, there was a lot of email discussion, but we had the development order in front of us, in fact, before the meeting for our review, to be able to make a determination.
I can assure you that we reviewed the transcript in detail after the hearing, and my office is very confident that you follow the right procedures and that we'll defend the lawsuit if it's filed.
Mr. Constantine, anything further?
No, I'll ask. I have some other questions I'll ask later.
Fair enough. Clint, do we have anyone else on the line for public input?
No, sir.
Thank you very much. So we will close public input unless there's someone here in the audience that failed to fill out one of these yellow forms. Anyone that's failed to fill one out, desires to speak? Seeing none, we'll close the public comment session. Thank you very much. We will now recess the BCC meeting. We will move into our work session. And we are going to, if it's okay with the rest of the board, since we have so many people here to present, we're going to move the work session workshops around a little bit. I know we have the Rosenwald school issue, which is item number 9. Is the board okay if we jump to 9?
I'd prefer
and come back to 8?
Yes.
Out of respect for those that are here? Thank
Absolutely.
you. Does staff need a few minutes to put things together, or are you ready to go?
We are ready to go.
Ms. Cohen, the floor is yours. Thank you very much.
As the county issued a request for qualifications for the redevelopment of a 12-plus acres of the county-owned property, formerly known as Rosenwald project. In response to the request, we received 4 responses, and the county conducted a community meeting on July 30th, where the presenters had the opportunity to present to the community. Those 4 firms are here today to present to you, and they have 20 minutes for the presentations and followed by a 10-minute questions and answer period. With that, we are going to start with Blue Sky Communities, and representatives from the firm are here to present to you.
Thank you, Ms.
Chairman,
Cohen. Yes.
If I could,
Ms. Guillet?
while the first presenter is coming up, I wanted to just kind of share with you what staff is hoping to get out of today's work session. We would like to get some feedback from you. These proposals were submitted based on a scope of services, a scope for the proposals that you all reviewed. Staff has reviewed them and ranked them. We are not looking for you today to choose a proposer, but because they're all very different, we wanted to give you enough of an opportunity to listen to the presentations and ask questions and provide feedback to staff in an environment that would be more conducive to that than a regular BCC meeting, and where you would have the time to do that. What we would hope to get at the end of this is some feedback from you as to whether or not you're comfortable with where we are in this process. Do you want us to move forward with a recommendation on a proposer? Do you want us to continue to work on this or take it in another direction? Whatever it is, we just want to get some feedback from you with respect to next steps. So I just wanted to make it clear that we're not looking to you to select a proposer today.
Okay. Commission understood?
Yep.
Yeah, I think we would be a little difficult to do that since we haven't really decided what we're doing with community land trusts and those other things we've looked at. But we certainly want to hear these and understand where we're headed. Okay. So please proceed. We'll need your name, full address for the record, please.
Yes, sir. Good morning, Mr. Chairman and county staff. Thank you for, county commissioners, thank you for having us here today. My name is Ryan Ragu. I'm an Assistant Vice President of Development with Blue Sky Communities. Full address, 1227 16th Avenue North, St. Petersburg, Florida, 33704. As mentioned here on behalf of Blue Sky Communities, I'm joined by my colleague Adelia Richmond. Adelia is a director with Green Slate, a local zoning and land use expert. And together we will walk through Blue Sky's presentation for the redevelopment of the Rosenwald School property. So, as you know, we are responding to an RFQ that the county put out after working with residents. Excuse me. After working with residents in the Wynwood East Altamont neighborhood for quite some time. I apologize about that. I'm not sure if that's anything that I'm doing on the feedback. All right, I think we're okay.
Everybody just make sure that you're muted unless you're talking. That includes those individuals who may be listening from home, on the phone, or otherwise. Would be very helpful. Thank you, Ms. Ragu. We will not penalize your time.
Thank you. We're all getting used to the technology.
Indeed.
As I was saying, this is a response to the an RFQ that the county put out after assessing the needs of the local residents of that East Altamont neighborhood. And you see some of those specific needs listed there on the screen. A need for mixed income and elderly housing, a need for local residents to have a first priority on any affordable developments, a need for a new community center, educational, vocational training, and so on. And Blue Sky is very confident that we can meet those needs and we can meet them to a very high degree of quality because that is something that we've done very well in the past in other neighborhoods. So as we walk through this, we'll tell you a little bit about who Blue Sky is, some of the things that we've done in the past. We'll tell you what we hope to do here on the Rosenwald site, and we'll tell you ultimately how we see that development benefiting the local community. So to start things, we have a video from Sean Wilson. Sean is the president of Blue Sky. We do have Sean with us today in person to answer any questions that the county may have, but we wanted to be able to share this video with you to showcase one of our newer developments.
Good evening, everybody. Good evening, neighbors of the Rosenwald school property. My name is Sean Wilson, and I'm being very careful, and I hope you are too. In these strange and scary times, it's important that we keep in mind the most important things in life, which are health and our family. So I urge you all to wear masks and take all necessary precautions. Now, we are here at the Preserve at Sable Park, which is a two-phase development similar to what we're proposing at the Rosenwald school property, 2 phases. And phase 1 is complete. It's a series of 3-story buildings with a clubhouse and a pool and solar panels. Phase 2 is 4 stories, and that's under construction right now. We are just so delighted and appreciative of you, the neighbors, for inviting us in to present a synopsis of our proposal. We're also very thankful to county staff and county officials for making this property available for affordable housing and other community uses. Blue Sky really specializes in this kind of development. Not only do we specialize in this kind of development, but we specialize in this kind of a community where there's an active component of community engagement. We want to create a property that is specially tailored to what you guys want and to what the county wants. And so we hope to achieve that. And you're going to hear a lot more about that from my team who is present tonight to finish this presentation. Now, what is Blue Sky proposing? And you're going to hear lots of details about this later on. But we're proposing 180 affordable apartments, 90 for elderly, 90 for family, 4,000 square foot community center for the community, and the architecture for that community center will be based upon the traditional Rosenwald school, and we hope to include some elements from the existing buildings into the community center. We're also proposing a preference for you, the neighbors, that will allow you to take advantage of this housing opportunity in a manner that meets the fair housing guidelines and the other compliance requirements that we have to adhere to. We're also proposing to purchase this property from the county for $2 million. And finally, we're proposing a strong community engagement process that will not only involve meetings and feedback, but a $50,000 grant to the community that can be programmed according to your needs, because Blue Sky is so appreciative that we want to give back. So community engagement was important to the county, and it's important to you guys. We proposed a comprehensive community engagement process that really involves 2 different mechanisms. First, is a constant feedback loop with a lead community partner. Now, we initiated conversations with one potential lead partner. We did not consummate those, but we're willing to take on a lead community partner that the neighbors could designate or the county government could designate. And that lead community partner will participate in all of our team meetings with the architects and engineers, and will be able to provide constant input on what we're doing, and they will be able to filter what we're doing back to the community. The second way that we're hoping to do community engagement is through mass meetings like this. Now, we think that 2 or 3 big meetings are probably enough, but if we need more, we'll have more. We are proposing one big meeting before we even sign a contract with the county, and then we're proposing another big meeting after we win our funding for the affordable housing, but before we actually finalize permitting. And we think that this comprehensive community engagement process will really fulfill the spirit and the letter of the county proposal. You, the neighbors, are our customers, and the county is our customer too. That's the way we view it. So we want to create something that you love, that you cherish, and that makes sense for you. Otherwise, what's the point? So we look forward to working with you and with the county to create a product that is made especially for this area at this time. So thank you very much, and enjoy the rest of the presentation.
Great. And I will say, you can probably tell that was tailored a little bit more to a presentation we did with those local residents, but you know, one of the biggest things I hope you can take away from that is just Blue Sky's level of passion for affordable development. That's really what we're all about. So a little bit more about Blue Sky. We've been around for just over 8 years. In that time, we've completed 11 developments and have about 12 more either under construction or coming up here soon. We are, again, an affordable housing specialist. All of our developments are affordable housing communities. We are a recognized leader in affordable housing, both throughout the state and within the local communities that we represent. We make sure and advocate for those communities. And we are also the property manager, and that's something that's very important. When you work with Blue Sky, you're not working with a group that's just going into the community to put up a building and then sell it to somebody else. We invest in our communities, and we become true long-term partners to these communities, and that's something that's very important to us. So we'll talk a little bit about some of the developments we've done in the past, and the first one I'll present to you here is the Preserve at Sable Park along with Sable Place. Now, these are Phase 1 and Phase 2 of a combined development. You saw these in the video that we had with Sean earlier. This is similar to what we're proposing here for the Rosenwald site. We're proposing a 2-phased development. Phased development is a little bit more complex, has a few more moving parts, but as you can see, this is something that we have been very successful in. This next one, Blue Sky Brandon, this is one of our signature communities, and what you can see on this one is just the level of quality and detail that we like to bring to our communities. You see on the outside the nice brickwork, the large patios and railings. Inside the unit, you can see granite countertops, stainless appliances, a nice tile backsplash there in the kitchen. Again, really just goes to showcase the level of quality that we like to bring to our developments, and certainly the level of quality that we hope to implement at the Rosenwald site. Arbor Village is one that we just wrapped up down in Sarasota, and this one is a great example of addressing a specific community need. Now, the need in Sarasota was homelessness. Sarasota struggles with a very high homeless population in and around their downtown area. And so we were able to develop this community to address that need, but we also worked with a local nonprofit partner, and they came alongside us in this development. They were able to connect those residents with caseworkers, get them health and social services and other needed items. So again, we went beyond putting up a building and really worked to address the need of that area. This next one, Woodwinds, is not too far from here. It's over in Claremont, just outside of Orlando. This one is actually an award-winning community. We received an award for excellence from the Florida Housing Coalition, I believe in August of last year. Our president, Sean Wilson, received that award in front of the entire industry and gave a speech to to the entire industry about this particular community. So again, it just goes to showcase the level of quality that we bring to the table, and certainly this is one that we're very proud of. And this last one, Fair Lawn Village, this is one that I'm personally very excited about. Had the opportunity to be a little more hands-on with this one than some of the others. We're gearing up to break ground on this one next month, and I can tell you personally about the high level of community engagement that went on into the planning process for Fair Lawn Village. That is something that was very important to that community, as we know it is here in this case. So what we did for Fair Lawn is we worked very closely with the district commissioner and her team for the past several months. We've held multiple community meetings, some in person and some on Zoom after the pandemic hit, engaging with those local residents. And we've also worked to establish and are working towards local minority hiring goals, to where we're again working with those local residents and providing opportunities for employment in the actual construction of the community. So we've been able to establish some great relationships there with that community, and certainly hope to do the same here. So now I'll turn it over to Adelia to tell you a little bit about what we hope to do at the Rosenwald site.
Thank you.
Thank you, Ryan, and thank you, commissioners, for having me here. I'm going to state my address is 1615 New York Avenue, and that's Orlando 32803. I am the Director of Land Development with Green Slate Land, and just want to go back to the site plan. As Sean and Ryan has mentioned, we are proposing two separate developments. We are proposing a family and senior. As you look at this particular site plan, you will see the layout from the ponds to actually using Lake Mobile as a feature point. And as you can see on this particular site plan, we're actually proposing a community center as well as clubhouse, playground. And this is really to provide a more cohesive plan and the best and highest use for that property. In the next slide, I'm going to go into more detail about the actual community center as it was identified, and the residents identified needing a community center, as the community center that's currently there is at capacity. So in the next slide, perfect, thank you. So the historical integrity. The Rosenwald School, I'm not sure if everyone's up on their history and the importance of the Rosenwald schools. So all throughout the South and a number of places, these different schools were built with the help of the community, Julius Rosenwald and Booker T. Washington, to actually provide free black slaves and free people the opportunity for education. And so with the community school, you'll see here that we're proposing is to really honor that legacy and to construct something that is appropriate for that community in order to continue the historical integrity. So we really want to do some educational preservation and really work with the community to provide different types of educational opportunities within that community center, and to also provide the community with access. One of the things that came up repeatedly was not having access to an actual meeting area, somewhere where the community can actually gather. So in this, we're showing an actual similar rendering, and the reason why we wanted to talk about renderings versus what you actually get after construction is to demonstrate the level of how things change, from community input to different regulations and everything else, from what is proposed to what is actually developed, and some of those high level of standards that is put into the actual construction and actual development of a proper community. So in this particular slide, I'm going to turn it over to Ryan as he works more with who lives here and how they gather that particular information.
Thank you, Adelia. So we'll talk a little bit about who this community is actually going to be for. And you see some information there on the right-hand side gathered from our other communities, and actually a photo there of some of our younger residents. And what you can see on the left is the income and corresponding rent level breakdown. So there's two main things I would emphasize about this slide. Number one, this is going to be an affordable, a mixed income, affordable housing development. Again, because we recognize that that was the specific need that was presented, and so we want to be able to address that. Now, the majority of residents that end up living in this community will likely fall into that 60% area median income range. In other words, making between about $20,000 to $47,000 per year. And what you can see here is for a resident or for a family that falls within that income range, if that family were looking for a 2-bedroom apartment, it would be just over $800 a month. that family were looking for a 3-bedroom, just over $900 a month. So a really great, affordable option for the local residents of that community. And that brings me to the next point, which is that ultimately who is going to live here is going to be the existing residents of that community. Again, we recognize that that was a need presented for local residents to have a priority on any new affordable developments. So we want to be specific in addressing that. And I'll actually turn it back to Adelia, who has some experience doing that at another community and some ideas about how we can do that here.
Just an update, you've got about 5 minutes for your presentation.
Awesome. So I actually sit on the Hannibal Square Community Land Trust. I'm a board member there, and this is an example of a local resident priority sheet that we use in order to capture people who live, work, and play in the community. You know, the whole point of doing these type of developments and these type of communities is to help encourage and uplift that community and provide a better stance for it in the future. These are legacy type of communities where people are already living there. There's already a great amount of information being driven through that community, and you want to keep it there. You want to keep those residents and keep that capacity there. So if you look and you go through this, if you can read it, it kind of gives you an idea of some of those questions. This one was developed for a project in Winter Park, and obviously we would tailor it to this particular community so that we can capture folks who live in that community. And back to Ryan.
All right, so we've been talking about addressing the specific needs of the East Altamont community. A need for mixed income affordable housing, a need for local residents to have a priority. And we also recognize the need that was presented for education, vocational training. And the way we want to address that need is through offering resident services such as the ones you see here. Things like adult literacy lessons, employment assistance programs, financial management classes. These are courses that we currently offer in many of our other communities, and we've seen the power and the impact that these courses can have for those local residents, and we believe that these can do a lot of good for the residents here. So to bring it home, we'll talk a little more specifically about how this development will ultimately benefit that East Altamont community, and it comes down to a couple key things. Number one, as Adelia mentioned, we are proposing to develop 180 units on the Rosenwald site, 90 for elderly and 90 for family, again, based on the needs of that specific community. And we believe that this will have the greatest economic impact for that area. Blue Sky is offering to purchase the Rosenwald site for a purchase price of $2 million, so we will pay the county $2 million for that Rosenwald site, and $25,000 of that $2 million will be made available immediately upon the signing of a redevelopment agreement. We've talked about the Rosenwald School. Now, this is something we recognize is very important to that local community, and certainly we want to do our part to honor that legacy and really keep that alive. And the way we propose doing that is by developing, as you see there, a 4,000 square foot community center built in the original architectural style of that original Rosenwald School. And we would also work to salvage and incorporate any pieces of the existing structure as we're able to. You see some potential uses there, things like after-school programs, adult education courses, faith-based gatherings, really whatever the residents of that community want to see in that space. In addition to the $2 million purchase price, Blue Sky is offering to pay a $50,000 charitable grant to the community, and we would certainly want to work with the county to determine how best to go about that. We see that playing out as a $10,000 grant per year over the course of 5 years, and we would make that initial $10,000 available immediately on the signing of a redevelopment agreement. And the last thing I would emphasize is our approach to community engagement. Number one, it entails meetings like this with county officials and local residents. The second aspect is bringing on a lead community partner. Now, that is an individual or group that we would work with you all to identify, who would become an ongoing part of our development team. They would sit in our weekly development meetings and be able to offer feedback on behalf of the community at each step in this process, and we feel that that's very important. So in summary, we have the right experience, we have the team, and certainly we consider you, the county, a part of that team. We feel confident that we have the most to offer for the Rosenwald site. and most importantly, Blue Sky will really be a true long-term partner to that community. So with that, thank you very much, and I will open it up to any questions.
Thank you, sir. We appreciate it very much. Questions from the commission?
Mr. Chairman?
Commissioner Constantine, please.
Thank you. I believe that, I have some questions for Blue Sky, but I'm hesitant to do the questions now because I know we have 3 other groups, and I don't want to go in the middle of that. Will we have an opportunity at the end to ask specific questions of different groups instead of just each time doing it now?
I mean, we can, but I hate to
If we
keep
don't use the whole
all
10
of them
minutes.
here
Yeah.
waiting for the other presentations unless they're all willing to stick around and wait till everybody's, I mean, we've already prolonged them long enough today. Are you referring to specific questions to staff or what is your flavor?
Blue Sky offered some things that I see, great potential. I don't know what the other groups are asking for yet, so it's kind of like I'm going, without all the information. So I'm just saying I want to ask questions maybe of them later after I hear all the others.
Well,
And let me just say, we can stick around if that helps. That's not a problem.
Commissioner Lockhart?
I do have a couple of questions for this applicant specifically.
As
this
do I.
Proposal.
I do as well.
Proposal.
I mean, today, we're
know-
not here to make a decision
Right.
on one of the other. We're taking all this in to give our staff direction on how to move forward and probably bring these people all back again. So Commissioner Lockhart?
I will say, all of the plans from my perspective seem to be like an affordable housing project with some community stuff thrown in. And I was more hopeful that it was going to be something that was for the community with some affordable housing. And every single one of them seemed to dominate with affordable housing. So that's my comment in general. But specifically, I've got a question for you on page, well, there's no page. Under community engagement, you refer to the area study plan that the Renaissance Planning Group did in 2014.
Yes, ma'am.
And that you're fashioning your community engagement around that plan. Can you share with me who solicited that plan? It's not something I'm familiar with.
I believe that plan, I'll let Sean weigh in on this, I believe that plan was actually provided to us as part of the RFQ.
Commissioner, that is the plan that was done following the Sunrail station. So that's our Winwood East Altamont plan.
Okay, was that done in conjunction with the city of Altamont?
No, City
That was just
of
our plan.
Altamont's plan was finished before that, and parts of that are incorporated into the plan.
Got it. I was surprised that I was looking for something related to the We Care plan. Was that something that was provided to you as well?
Not to my knowledge, but certainly, that's something that we can take a look at if that can be provided.
Okay.
And the We Care plan was incorporated into our plan that we did with on the Renaissance plan that they referenced.
So We Care was within the Renaissance plan?
Yes, it was a consideration and part of that plan.
But it wasn't necessarily identified as an independent?
It's identified in our plan specifically as one of the elements that contributed to the recommendations that are included in the plan. I'll refer to it as a Renaissance plan because that's a consulting firm that prepared it for us. But the We Care plan is specifically referenced in our plan.
Okay. What is the affordability period for your development?
To be honest, I will defer on that one.
The state requires 50 years. We have agreed to perpetuity. Sometimes it depends on what the local government wants, whether you want a longer or shorter. But standard is 50 years.
Okay. And when you refer to a community partner, you didn't call them a partner, a liaison.
Lead community partner.
Lead community partner. Is that person going to become essentially a part of your team? Would they be a team member of your team, or are they going to just be coordinating outside of your team?
Well, they would be part of our team, and it could be a person or it could be an organization.
So would that entity at that point as a part of your team be considered for compensation?
Yes.
Okay, thank you.
Ironically, that's one of the exact same questions I had. I have a couple comments, and then we'll go to Commissioner Delary, who's waiting. First and foremost, this area of the county is very important to me as a person in general, as being a long-term business owner in that region, in that area. Literally, I can throw a baseball pretty much from my commercial business, my automotive business, that has been there for half a century now, to these folks. It's very important to me that this community does get a community center. It's very important to me that there be a healthcare aspect to this, and I want to hear from the community as well. I think it's important. Long-term affordability is something we have to look at. This is not something that I'm interested in a short term. I want this community to be able to thrive. I want them to be able to excel. I want them to be able to get a lot of the things that, quite frankly, they've been ignored for many years and many decades. I think there should be an educational aspect to this as well, in conjunction with either our school board, whether that's a small STEM satellite project, whether it's a kindergarten project. I think holistically, this is going to be a big community center for this region. So hopefully staff is paying attention to some of the things that we're saying as a commission that are important to us. The long-term affordability was one of the questions that I had as well. Sounds like you've answered that. I would like to know a little bit more about your community land trust experience. I know that Adelia has worked with the Winter Park Group and is a member of that group. Tell me a little bit about, beyond that, your experience as a community land trust and how many projects you perhaps have done with community land trusts.
Thank you very much. And just for the record, my name is Sean Wilson. I'm the president of Blue Sky Communities, and our address is 5300 West Cypress Street in Tampa. Blue Sky has not done any community land trust development so far. We have done several nonprofit joint ventures where we had a lead community partner, and those lead community partners were actual partners in the entity. So, but unfortunately, we have not done a community land trust development yet, not because we don't want to, it just one has not come up yet. And I didn't know that y'all were contemplating that, or we certainly would have incorporated it into our presentation. We propose to purchase the land, but if there's a community land trust involved, then we would be leasing the land, but we can still accommodate a compensation at the level that we described in our proposal.
Sure. In all fairness, this board really hasn't decided yet which direction we're going to go. So it's not something that we, unfortunately, weren't able to give you as far as the scope. The community partner, tell me a little bit about the vetting and how that is chosen, whether it's a person or whether it's an entity. What considerations do you give to that community partner?
Well, we would prefer that the lead community partner be a 501c3 organization with a locally based board, and with or without staff. It doesn't matter if they have staff, but we would prefer that it be an organization. It could also be a group of faith-based institutions. But we wouldn't want it to just be a person or a company or a church. We would want it to be a group of people that really can speak for the community, or at least has the confidence of the community.
Sure. And do you feel, in your corporation, in this scenario, is it important to you that the community itself has significant input on whom that community partner would ultimately be?
Absolutely.
And how would you accommodate that?
Well, we don't have any experience in this area, but so the first thing we did when we started reading the RFP and the community plan was to Google around and look for a potential lead community partner, and we reached out to the South Seminole Community.
Association for Progress.
The SSCAP, I think, right? We reached out to them and had some really nice conversations. To me, they were, they seemed like an organization that could be a potential. So, I mean, we would look for your input and for staff's input on how to bring together a lead community partner organization. And if I could also address the reaction by one of the board members regarding there was more affordable housing and less community, it seemed like. I want to point out a couple things, that in the plan that we were provided, the first goal listed was, I think it was called mixed income and elderly housing. So since that was the first one, we took it to mean that was the primary need of the community that we tried to address. And so that's why it's heavily focused on affordable housing.
Great. Thank you. Commissioner Delary, you've been...
Thank you, Mr. Chairman.
waiting.
Right now, I see this as an affordable housing complex with an element of the community. As we move forward, what I'd like to see or hope to see would be is how we are actually transcending the Wynwood community. I don't see much on this plan or information about the Wynwood community. I just see this about affordable housing element with a little bit of the community. When you talk about Hannibal Square, from what I've seen going down there, it's people have lost or starting to lose their identity because you're seeing more and more big buildings. There's a new hotel moving in that area. There's a couple big commercial pieces. I don't want the Wynwood community to lose their identity. And I don't see right now what you're doing to either help the community with their identity or move them forward. I see this as an affordable housing project. And I don't see the data in your proposal to say that we need to have all this new housing in this area and nothing about the Wynwood community. You talk a little bit about the Rosenwald, that's great, but I don't really hear much about what are we doing about Wynwood. Can you elaborate on that, please? Because I see this as the anchor. This is the catalyst. This is the seed or the mustard seed on how we're actually going to help the Wynwood community not only flourish, but keep their identity.
And with that said, just a reminder, we are about 12 minutes into the question
That's going to be my only
segment.
question.
I'm not penalizing
That would be my only
further
question.
statements, but just a heads up, we got several others to go yet.
So, Commissioner, I want to address the mustard seed concept. So, with Hannibal Square, what we saw was it was kind of too late. Once you get going and you don't take the time to really plan, to really put the people in place, to have a community leader, to have these type of conversations, you are bulldozed. Especially these more sensitive communities, you find yourself in a situation where you're just kind of watching everything else grow up around you. I think what we're proposing here is something where we can have a lot of community engagement, where we can encourage the community to be more a part of their community and have a say-so. The reality of a mustard seed is the concept that one person can make that change, and I think that change is happening here right now. And I would encourage everyone here, especially within that particular community, as someone who's volunteered there, who's made those connections, to really understand that that is their fear. It comes up every time they're at the church, it comes up. It's constant. What happens when development goes here? Do we still live here? Are we still a part of that community? Are we still a part of the fabric? And I think these conversations are important, and right now we have the opportunity to pave the way, really.
Thank you. Commissioner Constantine, any inquiry, sir?
A lot of the questions that you all answered, but one of the things about this lead community group that you talk about, we've mentioned that a bit, instead of having a single group, I've noticed that there is a diverse amount of different people that sometimes claim leadership in Wynwood and have done so for many, many years. I might suggest a community committee, a much different type of situation than one group and identified them as this is the group. I would that's just something as a suggestion that I would look at. That's-
Okay. Thank you all very much for your presentation. You're welcome to stick around if you'd like. In the event that the commission has any additional questions, hopefully we're going to proceed with our plan with the 20 and 10, but we're not going to preempt you from sticking around, and we're not going to preempt our commissioners from asking more questions. Next up, we have, looks like Southport. Is that correct? Okay. Well,
Yes, the next presenter is the Central Florida Regional Housing Trust, Bright Community Trust.
okay. Sorry, I have it all out of order on my notes. My apologies. Who will be next? Ms. Cohen? It's going to be Southport or?
The Central Florida Regional Housing Trust / Bright Community Trust.
And who is going to be following that?
Schumer Capital Corporation, followed by Southport Development.
Thank you. Welcome.
Thank you all. Mr. Chair, commissioners, staff, colleagues, and community, it's a pleasure to be with you again. I think the last time I saw you all together, I was here with Mark Brewer and Rob Panavento talking about our efforts with the Regional Housing Trust and the Regional Housing Impact Fund. It's great to be back in front of you today. The Central Florida Regional Housing Trust is a locally governed organization that's operated by Bright Community Trust, which is our state's leading land trust. We work on housing access and housing affordability and other aspects of community development. The CFRHT was 3 years in the planning group that was convened by the Central Florida Foundation with technical expertise provided by Bright Community Trust, engaging with cities and counties, with academic partners, with business and community leaders, with nonprofit and for-profit developers and builders from around the region. We serve several principal functions here in the region. First is to lead a regional housing strategy, a kind of metro plan for housing in the region so that 10 and 20 years from now, fewer families in our region spend more than half what they make on housing, and so that our employers can more easily recruit and retain the employees that they need at reasonable wages to grow businesses and grow our regional economy. Second, we exist to fill gaps in the development world that require a special blend of development expertise and community engagement, and a project like this is a fantastic example of that. Third, we serve as a land trust for any city or county, for any nonprofit or for-profit developer where there's a desire to have a permanent affordability component. And fourth, we fill gaps in the community. My colleague Tracy Blue will talk a bit more about some of our work in that regard later in the presentation. Over the years, Bright has developed, in cooperation with other developers, over 500 multifamily rental units at below market rate rents. We've also developed over 100 single-family homes for sale to first-time home buyers like teachers and nurses, police officers, firefighters, and many more in the community. The Central Florida Regional Housing Trust is now developing a number of projects like this around the region, including in Seminole County. When we arrived here, we were quickly engaged with an existing coalition of great partners to respond to your RFQ. While there's a lot of expertise on this team, we were able to organize and lead the response, bringing our unique blend of real estate development and community engagement experience as a 501c3 nonprofit organization. And based on your response to this presentation, we intend to utilize all of these partners in their respective areas of strength. And once the project is developed, then we'll turn it over to our colleagues at Catholic Charities. You'll hear from them a little bit later. I want to say a big thank you to all of our team that made this presentation possible, not just the three of us that you'll hear from today. Now, in our packet, you will see quite a few letters of engagement and support. I'll try to click through these quickly. Father John Blewett is here with us today. Catholic Charities, of course, will also be presenting. The Seminole County Sheriff's Office was kind enough to give us a letter of support. We believe that a substation at the Rosenwald site will be a big asset to the community. We've engaged with them very actively, particularly around the East Altamont Community Association. Seminole State College will be a fantastic education partner there. able to provide both traditional academic as well as vocational training on the site, architecture, construction, Community Solutions Group at GAI, Whitestone Construction specializing in senior housing, Harvest Time International, another great local nonprofit organization, Shelley Lawton and her consulting firm. I'd like to take a second to recognize the challenges of coronavirus, because I believe that the uncertainties around this current pandemic make an ongoing consultation with the community and with the county, with our public health officials, even more critical before we move forward here. We need to understand what does it take to keep our seniors safe in a community center where they're going to be a key focus. We need to understand what kinds of educational retraining we need in this new environment to be prioritized in light of job losses. We also need to understand how these uncertainties are going to shift incomes for renters and for potential home buyers. How does that change rents and purchase prices and underlying financing? And so then, what public and private resources are available to support a project like this? I know we're all figuring that out as we go. We believe that these factors suggest an even more deliberate approach to the programming and development of this wonderful site. With that in mind, our approach is to lead community engagement and in consultation with county officials and staff to discern the best mix of uses for this site. We've read the plans, the Renaissance Plan, the We Care Plan. We've spent a lot of time with community members. I've been at every East Altamont Community Association meeting since March, been to church in the community at New Bethel before they were forced to shut down by the pandemic. We've heard a number of key ideas. First, that we need to honor the history of this site. This has a really unique history and a really important place in the community. We need to spotlight that legacy. Second, we heard clearly that Rosenwald needs to be a gathering point for the community with a special focus on the seniors in the community and for the youth. Third, we believe that Rosenwald needs to provide education and business opportunities on the site to nurture opportunity for residents now and also for future generations so that we can raise incomes and provide the credentials to get better jobs while growing community businesses. Fourth, Rosenwald should be a connection to other kinds of community services that can be delivered more effectively and more efficiently when they're located together on the same site within the community. And of course, then, there's a discussion to be had about what mix of housing would be appropriate on the site and what mix of income levels. When we say mixed income, do we mean only low and very and extremely low income? Do we mean moderate and market rate units also? Do we mean only rentals, or do we also include some for sale units to increase home ownership in the community? So let me turn it over to Gary Tester, the president of Catholic Charities, which will manage many of these programs and discuss their programs and their role. Gary?
Thank you, sir. Good afternoon. My name is Gary Tester. I'm president of Catholic Charities of Central Florida. The primary address is 1819 North Semerin Boulevard in Orlando. It's a pleasure to meet with you today, and it's a pleasure to be a part of this partnership. Catholic Charities has been serving the Central Florida area for 58 years. We started with services that were rather traditional at the time: adoption, foster care, counseling services, and food support. Over the 58 years, our services have evolved to meet the community needs of the 9 counties that comprise the Central Florida Diocese of Orlando, and that's exactly what we're engaged in today. Most importantly, we're already a neighbor to this property. We operate a program that was created by Father John and the folks at St. Stephen's over 15 years ago, called Pathways to Care, which is an assisted living facility serving a unique population of individuals who have come off the street, encountered a situation that required hospitalization, and cannot be safely discharged back to the street. And we're very proud of that program. I think we've been a great neighbor. The basic ministries that we provide are designed to transform a community, and so we work from the standpoint of food ministries. In 1 week during the pandemic, we averaged services, food support to households, about 1,700 households a week. Pre-pandemic, that was about 450 to 500 households per week. Our goal is to do all that we can to help families stretch their dollars and their resources as far as they possibly can, and to do so respecting the sacredness and dignity of each human life. We know it takes a lot of courage to come and stand in a line to get food for your family, and we try and respect that and respond to them accordingly. We also provide what we call a Family Stability Program, which is emergency financial assistance to families needing help with utilities, needing help with rent, sometimes with mortgage payments and other related expenses. We do all that we can to help them over the hump, not designed to sustain them in that, but to help them in the difficult moment they're in, to keep their home or to get them moving in a direction that will allow them to do that. We are also the largest provider of rapid rehousing services in Orange, Osceola, and Seminole counties. We have 5 case managers, each carrying a load of about 35 families that we work to get off the streets as quickly as possible and into sustainable housing. We recognize from a Catholic Charities standpoint that it's not enough to put someone into housing. We have to bring services to them and wrap around them to assist them. And so I described the food services, and you saw the presentation that suggested that there would be a food distribution availability in the community. We also provide behavioral health services. We work diligently to respond to individuals in need. This has certainly been impacted by the pandemic. People are not necessarily comfortable in coming out and visiting and saying that I need this kind of assistance. So we've developed a rather strong behavioral health telehealth platform that is HIPAA compliant that we are able to use. In July, we were notified that we are now a Medicare certified agency, and so our services importantly are available to seniors via telehealth, which allows them in the isolation and depression that is a natural result of the pandemic to be able to respond to them accordingly. We also do senior services. Typically speaking, our senior services have been based on a congregate care model. But in the pandemic, that's simply not practical. And so again, we've done a lot with social media and telehealth to be able to reach out to folks, to respond to their needs. We've been able to do some home visits in unique circumstances, and we would certainly anticipate bringing those kind of services into this situation. And finally, 2 years ago, we launched Resurrection Property Management Services, which is our own property management company. The Catholic Charities Corporate Board has identified affordable housing as a primary ministry growth area for Central Florida, and we are engaged in that process. And with our management comes all of the ministries that we just described. And we have other ministries as well, but I've tried to highlight for you those that would seem to have the most potential impact for this community. Again, it's our pleasure to be involved in this. And with that, I'm going to turn it over to Tracy Blue, who is the Director of Community Development for Bright.
Thank you, Mr. Tester. Welcome, Ms. Blue.
Thank you very much, and good afternoon, Commission. I'm Tracy Blue, the Director of Strategic Community Initiatives for Central Florida Regional Housing Trust. My address is 312 Becky Street in Orlando. We are currently working with Polis Institute, which is an organization that is instrumental in community outreach through asset mapping in order to identify and strengthen local leaders, organizations, and community resources in the target area. Part of their approach is to hire residents from the community to knock on doors and survey the neighbors about their preferred pillars of focus. Once those assets and focus areas have been determined, they will work with us to develop and facilitate community work groups based on the results. Toward the beginning of our outreach in Paramore, which is a similar historic community in Orlando, the world became mired in COVID-19 crisis, which shifted our focus significantly. Since people were required at that time to shelter in place and stay at home, we embarked upon a plan to ensure that the residents of Paramore had their major needs met. We learned that access to food was a major concern for households, especially those with seniors and people in vulnerable populations who might be at risk by leaving their homes. Based on this identified need, we sought partners in addition to Polis Institute to help us fulfill the need for food deliveries and developed a relationship with Second Harvest Food Bank. Polis does outreach to Paramore, to the residents in Paramore, to see who needs those food deliveries. And we at the Regional Housing Trust have worked with Reverend Dr. Spooney of Mount Zion Missionary Baptist Church and the Paramore Community Engagement Council. And each week, we provide a list to Second Harvest Food Bank to make those deliveries. Second Harvest has a core of volunteers and staff who make those deliveries of 20-pound non-perishable food boxes to residents who've expressed this need. Since April 22nd, we've had the capacity to provide food to up to 100 households each week throughout this program. And since June 1st, we have also gained access to produce boxes. We have access to up to 300 produce boxes per week to be delivered to Paramore residents who need that service as well. We're currently serving just over, actually we're up to capacity now at about 200 households, containing over 500 total people with non-perishable food boxes, and around 253 households containing approximately 747 people with the produce deliveries. Due to the weekly limitations on the non-perishables, those are delivered every other week, and the produce we're able to get out every week to those households. We're currently in the process of developing a partnership with Seniors First to provide Meals on Wheels services to those households with seniors over age 60 who would like prepared meals delivered either in addition to or instead of the non-perishables and produce that are being delivered. In addition to these weekly deliveries, we've assisted the Paramore Community Engagement Council with a drive-through farm share food distribution back in June to get food to families. Thanks to several community partnerships, residents were able to drive through and collect bags of non-perishable food items, prepared meals, fresh foods like steak, ground beef, cheese, and produce, and we were able to serve around 500 cars during that 3-hour event, which equates to over 1,000 people fed. In addition to these food deliveries and food access programs, we've been highly responsible to other identified gaps and needs in the community. For example, we've established a task force to increase census participation in areas with very low turnout, and are working through our weekly meetings on innovative strategies to increase the census participation in those hard-to-count areas. Some of those strategies include a census-a-thon contest with weekly drawings for those who send proof of their completion, and a food drop that we're currently working on that will take place at Camping World Stadium that will feature census workers who will be there to help the participants complete the census on their phones while they're waiting in line for their food. We're also working to establish COVID-19 testing sites throughout the Paramore neighborhood. And additionally, we're working with the Central Florida Service Collective to develop some options for affordable housing for national service members serving in the Central Florida area who are living on a minimal stipend. I'm going to turn it back over to Frank.
Thank you, Ms. Blue. Mr. Wells?
Real community engagement to us is not just a way to check the box to get to development work. It's an ongoing relationship building exercise. It's why I've been attending the East Altamont Community Association meetings. It's why I was there Sunday night with the Community Association and the Sheriff's Office, marching in unity to increase peace and justice in the community in the rain down 436, I'd like to point out. We take community engagement very seriously as part of the process, and we believe that we need to be invested in this community for years, really generations, to change outcomes in communities like this. That means that residents really need to take the lead, and what we do is facilitate their work. Like Tracy talked about the work we're doing with our partners at Polis Institute, the Community Engagement Council, and so forth. Part of our strategy here is to create a resident council that would inform the work going forward to find the right mix between a community center, educational opportunities, job and employment training, medical care, and so forth. We've responded to this RFQ like a request for qualifications. We brought you a great, very well-qualified team. We have the expertise, we have the experience, we have the financial capacity to develop and operate this project, but it needs to emerge out of dialogue with you all and with the community, and we think that we're not there yet to present a fully formed proposal until more dialogue happens. That will determine what the entities needed are, though we always lead with community and mission first on a solid financial foundation with the goal of permanent affordability for any homes that would be developed. Likewise, we don't have any intention of disposing of a project. We're a permanent community partner. It's part of what being a land trust is. In closing, the Rosenwald School was built by an innovative partnership. It was business leader Julius Rosenwald and visionary educator Booker T. Washington engaging deeply with communities. They built over 5,000 schools around the American South in what the National Trust for Historic Preservation called the most important initiative to advance Black education in the early 20th century. This team, with its strong mix of partners and a focus on deeply engaging the community to propel the vision, we believe offers the right path to transforming this local legacy into a hub that will drive prosperity for our residents and our community well into the 21st century. Thank you all so much.
Thank you, Mr. Wells. I'll go to the commission. Commissioner Lockhart.
Sure. Well, first, I just want to be clear. I feel like I need to comment on the fact that Seminole State College logo was a part of your presentation. As a trustee at Seminole State, the college is willing to work with anyone who would take on this project
Sure.
to provide adult high school or any other type of credentialing or certification. I just want to make that very clear. The college does not have a preference.
Right. Yep.
The college wants to
absolutely.
provide service. So.
Yeah. And I would imagine the same for the sheriff's office, right?
Yeah, I'm not going to speak for the sheriff, but I would agree with that statement as well. I mean, great that you've been working with them and talking to them. I just wanted to. I feel like I'm putting on another hat every now and again today. But
Every now and then.
every now and then. So the elephant in the room for me, quite honestly, I have to ask you about your scores. What do you attribute the staff scoring for your group? Because the presentation and what I just heard doesn't seem to be reflected here. Have you?
And I don't know that we've seen the staff scores, so.
I think there's a difference between an RFQ and an RFP.
Well, my apologies. I just assumed that everyone had been provided this information. So now the cat's out of the bag. Sorry about that.
It's quite okay. And I'll tell you that when we read the document, it's labeled request for qualifications.
Right.
And it's very much written like a request for proposals. It looks for, it asks for something pretty concrete, and we just didn't feel like we were there, right? So
What I was gathering that from your comments that you felt like you weren't necessarily at the place where you could put pen to paper on some of these important topics, and so maybe that's what is reflected in these scores. My apologies. I am so sorry.
No, it's
Today's
quite
going to be
okay.
my day. It's just going to be my day. Anyway, I appreciate the emphasis on the community and your willingness to work with the community. As the district commissioner, I feel I have to share, I don't believe Wynwood and East Altamont is broken and needs fixing. And I think that's one of the things that is tedious anytime you go through a process like this. The community is incredibly engaged and incredibly resilient. And one of the churches there in town, the Apostolic Church of Jesus, it does an amazing food distribution and delivery service. And so I kind of, I'm a little guarded and jealous of this community that they are already doing so much so well, and that they have not been provided some of the other resources that other communities have, and yet in spite of that have really done amazing work. And so I just sensed that a little bit from your presentation, and so I felt like I needed to speak up and say they're not broken. Anyway.
Commissioner Laurie.
Thank you, Mr. Chairman. I like the fact that it's an RFQ. I like the fact that you're going to be engaging the community to figure out what the true community needs are. I think that's something that we need to be understanding because, as Commissioner Lockhart said, there's a lot of pieces of this community that's not broken. But I want to make sure, as I said earlier, that we don't lose their identity, and I don't want to foster losing their identity. And the reason why I brought up Hannibal Square is because I thought that community is losing their identity. And I don't want that to happen here.
Mr. Constantine?
Yeah, and you know, I listened very closely, and I loved all the community aspect of it. But I thought the elephant in the room, and you said you're not ready, is just, where's the housing? I mean, what is your plan to provide there? I mean, we saw the food, we saw the safety, we saw the education, but you know, where about the housing? If you look at this study, East Altamont study that we provided, and then you also look at Altamont and everything, you know, all of those things, a community center, health opportunities, education, preschool or after school, things like that, all the, you know, an opportunity for potential food distribution. All of that is there, but it also is very, very specific that we need additional housing, elderly housing, family housing, and all you have to do is look next door to this property to see that that other project that is affordable housing for families has a long waiting list still to this moment. And 80+% of the people that live there are within a 2-mile radius. So it's people in the community, staying in the community, living in what they feel to be a place that is much more suited to their family and their community. So to me, the first thing that I want to look at is what housing is being provided to go along with all the opportunities that might be presented. And that's the one thing that I did not see in your presentation.
And we've successfully developed, as I mentioned, several hundred units of multifamily rental housing. We're known for our development work in single-family and townhouse development of for-sale housing. But until we discern what the right mix between those two is, we can create a pro forma and program the site any way you want, but we felt like we didn't have enough input from the community and from you all about what that mix between rental and for sale and the other community assets are, because it's not a huge site, so there are limitations on what could be done there and what's the right balance between those factors.
Anything else, Commissioner? For me, it's really taking most of this under advisement in the early stages of, we have put an RFQ out there, which basically doesn't require us to have a detailed model of what's ultimately going to happen, but I think we need to hear from the community. We need to understand what the community really wants. I have a good idea what that is. But then as we work our way through, as this commission ultimately decides how we're going to plug in affordable housing, not only in this area, but other areas of our community. The thing that's unique about the Wynwood East Altamont is it is so close to the Sunrail. It is so close to other transportation opportunities to allow the community to travel and work their way, back and forth to work outside of our community and other areas. So, for me, it's about taking all this under advisement and seeing what the options are. And so I sincerely appreciate you folks coming to show us what you're capable of and giving us your background, and that will be something for great consideration on my behalf.
And if I may, we're engaged in a development down in Osceola County at the other end of Sunrail. That's a transit-oriented development serving moderate income renters. So you can easily get to either of the two major hospital campuses. You could get to the downtown Orlando campuses of UCF or Valencia, be an adjunct professor. There are a lot of jobs that are suited to that moderate income band that could use Sunrail very effectively. That's very different from developing a low and very low income housing that may or may not really take advantage of the transit proximity there.
Indeed. Great. Anything else for this applicant? Seeing none, thank you all very much.
Thank you so
Mr. Wells,
much.
we appreciate it. Ms. Blue, be well. Mr. Tester, take care. Ms. Cohen, would you like to bring up next? I'm not gonna migrate those waters. I already messed that up once.
The next presenter is Schumer Capital Corporation.
Mr. Haynes. Welcome, Mr. Haynes.
Thank you, Mr. Chair.
Hope all is well for you.
Yes, sir.
Great. Well, take your time, get ready. Whenever you're ready, just give us your full name and address for the record.
Mr. Chair, do you want me to wait for the commissioner? Or?
Yeah, let's wait for Commissioner Constantine, who's working on his technology probably. Commissioner, are you all good?
I'm fine.
Okay.
I'm just hearing feedback, and I just wanted to...
Yeah, I noticed I could hear it
Yeah,
over
you
here,
could hear it too, okay.
Good, I was glad I had this plexiglass here, so.
Yeah.
Please, it's your pleasure, sir.
Greetings, Mr. Chair and commissioners. My name is Eric Haynes with Schumer Capital Corp. This is muffling my sound a little bit.
Please.
Eric Haynes with Schumer Capital Corp., 140 South University Drive, Plantation, Florida. Just to tell you a little bit about myself, because I want to get right into the meat of what we're proposing here. I'm a real estate developer. We specialize in urban redevelopment, urban development, licensed general contractor, state of Florida, licensed real estate sales agent, and I'm a former city commissioner. I sat in chairs similar to yours, City of Lauderdale Lakes, Florida. I was a commissioner for 13 years, 8 months. In that capacity, I served as vice mayor.
Who's counting? 13 years, 8 months.
13,
Right.
Yeah.
6 days and 12 hours.
That's it, right?
Okay.
I probably could have got the hours too, but.
In a pandemic, you count them, believe me.
So, former city commissioner, served in capacities as deputy vice mayor, on several rotations. I'm a past board member of the Florida Redevelopment Association. I served on that board for probably about 9 years and served in the U.S. Army. So that's pretty much who I am.
Right.
And my presentation as it relates to Rosenwald Gardens pretty much centers around my experience sitting on a dais and looking at communities and trying to understand what a community wants. You have my proposal, so you can get into the details of the nitty-gritty, but I learned that when I sat up there, I want to get to the meat and potatoes. So first, let me talk about our team. Schumer Capital Corp., Urban Point Developers, that's one of our subsidiaries, and the South Seminole Community Association for Progress. Our development approach, and this is how we approach our developments most of the time. We thoroughly review the RFQ. We participate in the site visits. We assess the community needs, and we did that by meeting with the community on the day of the site visit. First thing you do, we don't know at that point in time whether or not we want to pursue the opportunity, but it's important that we see who attends the site assessment visit, and then if there's residents involved, we want to try to get a feel and understand what it is about the community. What we did here at the Rosenwald site, we found some members of the community, and we decided to take a tour of the community and wanted to understand the community from the residents' perspective. So then again, we met with the stakeholders. Then we went back, we developed a concept. We came back and we presented our concept to the community to try to get some kind of buy-in, and we responded to the RFQ. This is preliminarily what we're thinking about doing at the site. We're thinking about incorporating the community needs as it relates to the community center, the offices, a community garden, and we're proposing some senior housing. What's critical about this site is the historical context of the community. That is something that resonates most with the community. And what we wanted to do in our concept was try to memorialize as much of what was on the Rosenwald site as much as possible. I mean, we didn't approach it from a standpoint of, we want to see how many housing units we can get on first. We wanted to take the community needs first, and then from there, we'll determine what's left over from giving the community what it needs, and then we'll determine what type of housing or whatever we can put on there. So one of the things we wanted to do was critical. We wanted to keep the entrance to the site. We wanted to maintain that look that you see right now, because that was a very critical part of the neighborhood and in terms of the identity of the neighborhood. This slide, I'm gonna go past that real quick. Then what we also said, we wanted to do the 2 buildings. The community talked about having a community center, and they wanted to have a museum. We assessed the site and we said, buildings 1 and 2 suits that purpose very well. Building 1, because the community talked about a culinary training center, they talked about space for meetings, and that was the old cafeteria. It was a big open space, it had a kitchen already in it, and it could be used for a multitude of purposes. Building 2 is a smaller building. However, that one could be perfect for community association offices as well as a museum. So let's go back to the multi-purpose building. We look at it and we say, these are the type of things that we can do in there. We wanted to restore the original facade. We wanted to take advantage of the open space on the inside, and you can see, based on some of the concepts, you can have classroom, you can have open space, the culinary school, you can have seminars with the seminar seating. This is what a multi-purpose center is about, and this is what the community was asking for, something that they could have to highlight and to do all the things that we're talking about here. Building 2, we talked about the museum, and in this office you can go ahead and you can have museum artifacts recognized in the community. And the good thing about this was that we wanted to bring attention to the community, and so the community can scream about its heritage and all that has happened there. And we envision that if we keep these elements on the premises as they are, that this would be a perfect stop for the Florida African American History Trail. It also brings people into this community, and they're able to tell their stories. They're able to tell their successes. They can talk about the famous congressman who grew up in the community, Congressman Hastings, as well as some of the other things that happened here. I'm going to go back to this slide right here. This right here is the Rosenwald campus as we envisioned it. We thought about having pretty much a 80 to 100 units of senior housing, and we wanted to take advantage of the Lake Mobile, so we kind of like created a concept where we create a horseshoe design where everything overlooks Lake Mobile. At the same time, we wanted interior features in terms of the entrances to the units, because if the seniors are there, we want the seniors to come out, we want them to congregate, we want them to take advantage of green space, things of that nature. We don't want to have buildings scattered all over. We wanted the seniors to, that way they can always focus on one another, they can check on each other. In that apartment concept, that's a typical layout of what we was talking about, the kitchens in terms of finishings, and the community room. And the community room would also have and embrace some of the identity of the community. Now that we get past that, let's talk about the players. We got Seminole County, we have the developers, which is me, and we have East Altamont Wynwood. Seminole County, based on the RFP, one of the things you want to do is you want to just basically redevelop the property. But you want to redevelop the property based on the concept, the primary principle that was in the RFQ was that you wanted the redevelopment to benefit the current and future residents of the East Altamont Wynwood community.
That's correct.
In a nutshell, the county wants a partner whose proposals responds to the community's identified needs. That's what you asked for. From the developer standpoint, as just being honest, with a developer, cash flow is king. The deal must pencil out. And how does the developer benefit from this project? Cash flow for cash flows from the tax benefits, cash flows from appreciation, cash flows from principal reduction, cash flow from developer fees, cash flow from general partner fees. I mean, let's be real. A developer is going to look at this from the standpoint of how does it cash flow. But we have another partner in here. The other partner, the other player is the community. And this is what the community said it needed. Oh boy, I guess my 20/20 vision is off right now. I'm gonna turn around and look right here. The community said that it needed a community center, a recreation center, a healthcare center, vocational training. They talked about a sheriff's substation, an African arts and cultural center, food distribution center. It goes on and on. You all see it. I don't have to read it to you. Y'all can see it for yourselves. But this is what the community said it needed. And, you know, we looked at this and we say, you know what? We think we can address some of the needs that the community wants and still allow the deal to pencil out where it makes sense to redevelop. But we thought about a bonus. And this is the thing I feel about the communities. And again, it comes from my experience of being an elected official, working hard in the communities. It's that oftentimes we tell communities, we tell them what we'll give them. You know, we don't necessarily listen. We tend to say, this is what we're going to bring into your community, and this is what you have to accept. Okay, and so something didn't click right on that. But what we did also with the community as it relates to this was that we decided when we wanted to partner with the community, we wanted the community to have more than just a seat at the table. We wanted them to be involved with the menu planning. We wanted them to be involved with all the programming. And so what we also did, and somehow it's missing on this slide, we decided to make the community a vested partner, a stakeholder in our development. And what we mean by that is we didn't say we're going to give you a couple of $1,000s. We didn't say that, you know, we're going to invite you to sit around and, you know, you look at our plans and determine what you need. We said to the community, we're going to make you a 10% equity partner in this deal. We're going to bring you to the table. You're going to own this. You're going to be an owner in this project. You'll be sitting at the table with me, and we're going to determine. Because one thing we have to do when we look at these type of engagements, we have to think about long-term sustainability. We can always give someone a fish, but it's better when we can teach the community how to fish and how to sustain themselves. And for one of the things we're talking about, like the community center, the museum, the community garden that they have, they'll have there, the association and the community will be able to participate in those cash flows. When we say cash flow is king, they'll be able to participate in all of those cash flows that we identified. But not only that, in our proposal, we propose that the community will be responsible, the association will be responsible for managing and overseeing the community center and the museum. From there, they'll get revenue streams from facility rentals. They'll also be able to program that in ways that they deem and seem fit, actually using the county as a partner with CDBG. I mean, there's oftentimes you all put out proposals for CDBG in terms of programming and thematic aspects of that. They can apply for that. Again, the developer fees and the equity in the development. So why select the Schumer team? We addressed the county's purpose. You wanted to have something that created a sense of identity for Wynwood. County wants a partner whose proposals and needs respond to the community's identified needs. Our proposal is both realistic and doable. We give the community what it needs and deserves. Those items that are highlighted in yellow are things that we think, based on the community center, the offices and the museums, that these are things that can be delivered in this community, and they get primarily just about everything that they ask for. And again, they get 10% equity participation. So the bottom line is simply this. I'm asking you, let's partner to do good and to do well. Select the Schumer team. We think we have a plan and a concept that is very doable, very realistic. Our motto is that it pays to do good. And if it pays us and we make money and the community suffers, then it's not doing well for the community. All of these things have to tie in. We met with the community, we talked about community engagement. We engaged this community, and I have here petitions from the community, over 120 signed petitions where the community says that they endorse our plan. They endorse our plan as we presented it to them. They like the features that we put in there. I have copies of these that can be given to the commission, but these are the originals. But again, 120 signatures from members in the community that surrounds the development who said that, you know, they support this project. Thank you very much.
Thank you, sir. Could we have staff make copies of those and make sure all the commission offices get a copy? Thank you. Okay, Commissioner Lockhart, you're up.
You know, I actually don't have any questions.
Hey,
No.
fantastic.
Yeah.
Commissioner Delary.
I know everyone's shocked. Shocked.
I have two questions. Mr. Chairman, but it's more for our staff. I'd like to ask our team, when this applicant is talking about 10% equity partner, how would that work, and have we ever done that before?
I'm not sure. We actually haven't explored that detail or whether or not it would be even an appropriate element of a partnership with the county. We'd have to look at that.
Okay. And then the next is, with the RFQ that went out, what actual items were we asked for the applicants to submit?
I can pull that up.
Because everybody's submitting a little bit different, and I was hoping that it'll all be somewhat consistent.
Yeah, as you'll recall, when we were it took quite a bit of time to put the RFP together. Procurement ultimately changed it to an RFQ, but we did work with each of you on the final draft and incorporated some of your changes, so let me tell you exactly. There were 15 items. A description of the responders team, a certified financial statement, complete description of the entity and identification of all partners, resumes of previous experience, identifying not less than 5 years of experience, a detailed description of the concept of how the property will be redeveloped to address identified community needs, maintain the integrity of the site's historical importance, and accomplish the intent of the request for qualifications. A pro forma, including a multi-year business plan. That was one of your comments, Commissioner. Mechanism for engagement of the community, proposed scenario for the disposition of the subject property during and subsequent to redevelopment, i.e. a land lease purchase. It's fee simple, a bunch of different options there. Project schedule, estimated build out and improvements, cost, proof of financial capability, identification of any anticipated financial participation or contribution of resources by the county, identification of intent to utilize other state, local, or federal funding, and then a concept plan with land uses and public improvements, any anticipated reuse of existing buildings, and then a primary contact.
Thank you. Thank you. Thank you, Mr. Chairman.
Mr. Chair, if I may, Commissioner Delary, the 10% equity piece was the 10% that the association would get as a member of the ownership team for the RFQ. So the association itself will have a 10% ownership stake, a vested interest in the development that's inside their community. It wouldn't be with the county.
So if the development went into the red, then the association would be responsible for that from a 10% standpoint?
No, typically what we would do in terms of operating losses, anything, the primary developers, myself and my partners will cover any shortfalls. That's what's contemplated in the operating agreement. There will be an operating agreement. It'll be a special purpose entity that's created specifically for the engagement. The association would have a 10% equity stake in that. They will participate in any profits or revenues that come from that. Any revenues associated with the community center and the museum would remain with them. We wouldn't participate in that as the master developers. Our operating agreement would say that. Any losses that's anticipated, the association wouldn't be responsible for it. Okay. And we're not asking the association to contribute any dollars to the project.
Thank you.
Commissioner Kunstein?
Thank you. Mr. Haynes.
Yes, sir.
you know, first of all, I wanted to say that, you know, what we requested in the RFQ and the amount of diversity that we're receiving, I think is a testament to the creativity that all the groups so far have given. I loved seeing the different approaches that each group is presenting. You also, there's just a couple of questions, and I'll just ask them and then you can answer. I didn't see a development plan as far as how many units and what the breakdown would be. The 10% equity ownership you just said from the home, would it be the homeowners association or would it be the community association? That's the second thing. And then the third thing is you're the first group that is actually not just presenting a facade of the building, but actually want to use the building that currently exists. Have you looked at that building? It's been sitting there for a long, long time. Can it actually be saved? I don't know if it could even be used. Have you done any studies as far as that's concerned?
We haven't done any studies. Again, I've been a licensed general contractor since 1994. Been involved with multitudes of buildings, whether it be high-rises, mid-rises, single-family homes, multifamily, and the buildings 1 and 2 are very structurally sound. I mean, there's minimal work they have to do in there to update them, but they're very structurally sound. The rest of the buildings, I couldn't attest to that. That's why we didn't propose in keeping any of the others. But those two seem to be in pretty decent shape. In terms of the association, I actually participated in a homeowners association Zoom meeting. We kept social distancing over the past week. And one of the things that was raised once we had the community meeting, we had initially engaged the South Seminole Community Association for Progress, and other members from the community, when they heard the presentation at the church that the county facilitated, they also talked about how they could participate as well. And one of the suggestions that we made, that we brought forth, was that in the operating agreement, South Seminole has opened itself up to any other group in the area that wants to be a part of their team, that they can be a part of that team as part of the operating agreement. As you know, there's a lot of flexibility in limited liability companies, and that can be detailed in the operating agreement to embrace everyone. In fact, members of the community raised that issue, and it was explained to them that way. The caveat that I had and what I told them was typically, again, by sitting on that side of the dais, typically when you respond to a formal request and you have your team, if you try to change that team during the evaluation process or post-evaluation process, it could be considered a misrepresentation. And so South Seminole, as they are included in our proposal as an equity owner, equity participant, then we can only deal with that in the operating agreements with the other associations and other groups that might want to participate, without considering our proposal invalid and getting tossed because we made some misrepresentations.
Anything else, Commissioner? The one question I do have is, I note gated senior living. Where did that come from? Give me a little idea of what the intent was there.
You know, I forgot, there was one more question that Commissioner Constantine asked, so I'll go back to that. Gated senior living came from the standpoint that, you know, our seniors are some of our most vulnerable in the community, and the dignity aspect of it. There's enough property at the Rosenwald site that as you create the approach going back to the senior housing, that there could be an area that's gated off, because, you know, if we're going to have the community center, and again, in my proposal with the community, that the community will run the community center. It's not part of the overall development in terms of the senior housing that we're proposing. So you need to have some kind of separation aspect to it. And so that gated aspect of it would be a private drive that goes alongside, that gives you access to the senior housing component. That way the public and the community can continue to use the buildings 1, 2, and that area out in front of it. And so that's where the gated aspect comes from it. And in our proposal, we talked about 80 to 100 senior apartments. It's in the narrative. in the proposal.
So following up on that question, and maybe I'm wrong, but many grant programs at the federal level, you sure that can be accommodated with a gated type community?
Absolutely. There are multiple low-income housing tax credit projects, subsidized projects that have controlled entry and access points. In multiple instances, all it is a controlled access point. There won't be a manned guard or whatever.
Sure.
Privacy, they call them privacy officers now because of liability. But yes, you can have a controlled entry access point going into a community.
Okay, great. That's all I have. Anything else from the dais? Seeing none. Well, thank you very much, sir, for your time today and answering our questions.
Thank you very much.
You're welcome to stick around if you desire to see the other presentations. Again,
Yes.
thank you and be well.
Thank you very much.
Okay, Ms. Cohen, we have our next presenter up, who is going to be Southport. Is that correct?
That is correct. The next presenter is Southport Development, Inc.
You know how I knew that, right? We had 4, we already heard 3.
It was the last one.
You're good.
Okay.
Hi, good afternoon, everyone. Thank you for having us here today. My name is Jordan Nelson. I'm a member of the development team at Southport Financial. For the record, my address is 4311 West Granada Street, Tampa, Florida. And we just appreciate you all having us here today and for this opportunity to submit this request.
Welcome. Good to see you all today.
Hello, I'm Bree Lemmerman, also part of the development team Southport. My address for the record is 2812 First Avenue South, St. Petersburg, Florida. We're just really excited to present for the Rosenwald Landing development, that Merritt Street redevelopment. As we go through our presentation, you're going to learn about our development team, our experience, the development itself, both financially and conceptually designed, the timeline approach, and just some previous experience to really show our best faith. Our development team, the core team, is going to be Southport Development as the developer. Forum Architecture will be the architect. We will have Von Bay Construction as our contractor on this project. And then additionally, Cambridge Management, they'll be responsible for the initial compliance and stabilization of the community as a whole. This core development team truly has past experience, proven record of just achieving the best when it comes to affordable housing and just quality housing for our residents. So something that's significant about Southport as a development team is we really are a one-stop shop. We're comprised of asset managers, project managers, folks that have experience in different areas of the region, both Florida and nationally. We have an acquisition team and just a one-stop shop overall. A relationship with our contractor and our management team is very established, which you'll learn throughout our presentation. A little bit about our history. We're just approaching over 40 years of multifamily development history, and 2020 marked a big landmark for us. We surpassed our 20,000 unit mark in our portfolio, which was a very exciting time for us and for our team. So a little bit more in detail about our development team. Forum Architecture, they're based in Altamont Springs. They're an employee-owned full-service firm. They've really, truly put their devotion into their projects. They've worked on local municipality projects, both in the city of Orlando, Altamont Springs, both multifamily and affordable housing. The next person on our team is going to be Carnahan Proctor & Cross, again, a local firm based out of Orlando, Florida. Truly a one-stop shop when it comes to design and civil design. Land planning, engineering, mapping, GIS, truly, again, they've had experience with the city of Altamont Springs, a lot of municipality work when it comes to roads and designs of community needs. Von Bay Construction will be our general contractor. We have a very established relationship with them. Something very positive about this organization is they're very familiar about the development needs of affordable housing. They're familiar with the requirements that are often included in our scopes of work, the significance of remaining within a budget and within a secured timeline. Cambridge Management is another partner of ours. They would be managing the property on a site level and on a compliance level. They have different departments, including asset management as well, to ensure that the property is fully operating at its maximum capacity. Just some other key players on our team. We have the Community Consents Group, a consultant that is well experienced when it comes to Florida Housing Finance Corporation needs. Our accountant and our real estate attorney, Reddick Flight and Jamison Pepple, they have been involved in almost every transaction that involves municipal money, Florida housing money, so it's a seamless process with this team. And then Xena Management Group, it's a minority-run business group that helps with our Davis-Bacon Section 3 and home requirements. Southport really puts its best foot forward when it comes to community engagement. They'll be involved in any required board meetings, any desired workshops needed with the community, as we want the community's input with this project, design, implementation, opportunities with this community. During construction, Southport, VBC as well, they make it an effort to hire local whenever possible. That includes WEBEs, MBEs. They want to hire local, work here, live here, really feel that sense of community. One note just regarding the community engagement Bree touched on as well, but we are very open to receiving feedback from the board, from the community when it comes to some of those design and features, so that's something we wanted to emphasize through our proposal. The overall development vision includes approximately 120 units. This is what was advised to us as being the most sustainable from our architect and our GC team, but we are open to fluctuating that. It would include both 1, 2, and 3 bedroom units at this time. And we are looking to do 100% of the units affordable. That would be through the duration of the property. We would do a lifetime perpetuity as part of our affordable housing community. Right now, our proposal includes 6 3-story multifamily buildings with 2 3-bedroom configurations. We are open to adding the 1-bedrooms as well. And we are doing a family demographic, which allows households to age in place, which we feel is really important for the community. It allows no age restrictions, so families can move in, they can have other family members based on their age as well, so there's less of an elderly restriction that we're proposing at this time. One detail is we are going to do a Florida Green Building certification that includes using materials across the board that are Florida Green certified, and that's further outlined in our proposal as well. Just some design key features, as you'll see later throughout the site plans and renderings. We're proposing an approximately 5,000 square foot flexible community space. That's something that the county really voiced they wanted. They mentioned they really wanted it to be a safe haven for storms, so Southport is promising to make this an American Red Cross certified storm safe haven, God forbid. We will also have a separate police substation in the front of our community, as the county also reflected they would like to have. The development will have a tot lot, splash pad, sport or shuffleboard court, whichever the community sees most fit, and a covered picnic area to really feel a sense of community within itself. Some other community enhancing features will be sidewalks, off-street parking, street and parking lights to really feel safe while at home, and a beautiful landscaping and pond. Currently, the site is zoned R1, all 12 acres, so our approach would be to rezone it as a PUD to really be able to house the apartments and the substation and the community center as a whole. You'll notice some significant dates in our proposed timeline. The significant one that I would point out is that we are looking to begin the rezoning process towards the end of this year after our third-party reports would be completed. Should we be awarded this community, we would be prepared to fully start that process. The site aerial view, you're all familiar, of course, with the property's location. It was mentioned earlier that there is a neighboring affordable housing community, the Point at Merritt Street, I believe it's called. And in our studies, we've learned that that property has maintained 95 to 97% occupancy. So the need for affordable housing is very clear. I think it was also referenced that they do hold a waiting list, which would kind of speak to the need for affordable housing in that region. And here is our conceptual site plan. Again, as we had voiced, we're open to community needs, and the boards want some changes to this as well. As of now, it holds the 6 residential buildings. In the middle, you have the amenities, the tot lot, the basketball court, and then the community center that we had discussed on. And in that furthermost south portion, you'll see that's the police substation. A part of the community, yet also it's separated so they can do their diligence there. The next few slides are just sample renderings of what we think we could produce at this site. You can see the 2 to 3 story garden walk-ups. As of now, we're open to colorings, landscape changes, all of which the community could help put their voice into. But again, I just think these renderings speak for themselves, really beautiful.
So we mentioned having a unit mix of three, 2, and 1 bedroom units. Some samples are above. Some key features that we think are important to include in our units are energy efficient appliances as well as energy efficient materials, which is all detailed in the scope of work during that construction period. I'll pass through these, just some details. We think that these unit plans are very conducive to both families and individuals, whether you're familiar with one another or whether you're friends, family. Each of these site plans kind of allows for a different demographic.
So Southport has some various financial approaches we can take, big and counties once. The first one would be the 2021 geographic RFA using the 9% tax credits. This would be due around September and October of 2021. We would need a local contribution of approximately $460,000, depending how that switches, to achieve that local preference goal that the Florida Housing requires. Just to show Southport's commitment to it, there would be an owner equity push into the finances based on our developer fee. And in regards to the land, we'll discuss on it later, but there's a land lease we would like to do all through you. The second approach would be the sale 2021 RFA, due around October, November of next year as well. That would only require a $50,000 local contribution to hit that preference. Again, would require some owner equity on our end to really put our best foot forward, and then the land lease again. The land lease we're proposing to the county, again, as everything else, we're fluid and open to conversations. The length of the lease would be 99 years, the perpetuity as well. The annual payment would be just over $12,000, which would equate to the overall payment of being $1.25 million, which is well over the land valued amount of $365,000.
One note regarding the rent limits, these are proposed for 2020. The key point that we like to point out is the difference between affordable units and the fair market rents that are charged in this community. We also took time to do some due diligence about what those values really mean to the community. You'll note some of the positions include mechanics, technicians, advisors, all within the community. Those numbers are from 2020. Residents working minimum wage would have to work 92 hours each week to be able to afford a modest 1-bedroom rental home in this community. And then one note for each county, there is an extremely low income limit. For Seminole County, it is 35%.
Southport Development and Rosenwald Landing would host different resident programs as we would apply through LIHTC financing. This would be through the perpetuity of our development as well. These programs are also in line with the county's intent to offer more to their community and the residents. We would offer adult literacy, which is a weekly thing, literacy treatments, and then employment assistance program, that is a quarterly thing with an employment counselor to help our residents truly feel knowledgeable when applying to jobs. And then the financial management program is going to be a series of classes to help you with tax preparation, retirement planning, and just overall financial budget and benefiting.
The next few slides just touch on some of our previous experience. This is one of my favorite communities as we developed it when I first joined the team. Garden Trail, 76 units of new construction. It is a 3-story walk-up family demographic community. Palm Gardens is located, in Lake Worth, Florida, 80 units. Some other features here, you'll see a snapshot of the building rendering as well as the tot lots that we try and include in each of our communities.
Just some additional experience. Calusa Estates over in Belle Glade is a 114 family new construction project, so it'd be a similar scope to this site. And then Laburnum Gardens over in Valrica, Florida, also new construction, 81 units for our elderly residents.
Overall, we're just extremely appreciative of your time today and of the opportunity to submit this request. We feel that our team is strong, committed, and experienced, and we really look forward to the potential of working together with the county and the community over at Wynwood. Thank you.
Thank you all very much. Let's go to the commission. Commissioner Lockhart.
Very thorough presentation. Thank you.
I'm good.
Commissioner Laurie.
I'm good, sir.
Mr. Constantine.
So your plan is to lease the land for 99 years and give a lease rent of $12,500 a year. And you're saying that the land is only worth $360,000?
Based on when the land appraisal was pulled, the land was valued at $369,000 on the county's property appraiser website.
School board made a good deal then. I mean, based on that, the school board made a good deal.
We overpaid for that, I think.
Yeah. So 100 units, and you were very thorough. You're dueling banjos back and forth, very good. But, so we've gotten 4 different, and I guess this is when I really want to talk to everyone. We have 4 different deals, 2 of which didn't mention any, a dollar amount or, what they would do to pay for the property. One was $2 million in cash, and one was $12,000 for 99 years. It's, again, very creative. Everybody has a different approach. And I guess I'm just wondering why you took that approach as opposed to purchasing the property.
So we've done this land lease program with other jurisdictions, and it's just proven to be successful. The county still has their name on something. They have a sense of pride of something. They're still getting that influx of income into the community, and I just think it benefits all the parties.
And in your approach, though, from your financing that you gave, the developer takes $3.6 million immediately out of the project.
Are you referring to the projections?
Yes.
So in that included developer fee, that's what's awarded throughout the duration of construction and throughout the life of the community. That would not be taken up front. That would be part of the fee. That would be
over 99 years?
That would be provided at the end of the construction period.
Okay, so after 2 years.
Correct.
Okay, thank you.
But again, a portion of that would be our owner equity, which we'll put in to cover the differences in costs throughout the project's construction.
Great. Oh, on the sense of pride and ownership of property. This county owns lots of property. Some that we may be prideful of, some maybe not so much. So, in your proposal, written proposal, it talks about SP Landing LLC commits to own and operate this facility for a minimum of 15 years. So what happens in the 16th year? Can you explain what that's meant to indicate or possibly indicate, or what options that affords your firm?
Absolutely. Yes, so part of the Florida Housing Program is that you commit to a 15-year financing, at which point you become eligible to reapply for additional tax credits, whether it be through preservation or some of these other avenues. So at that point, we have the opportunity to recycle, if you will, the community, to receive additional funding to help rehabilitate should the community need rehabilitation on any different level. During that period, we are not eligible, nor would we have any intention of removing the affordable component of that, as we would commit to keeping that an affordable community throughout the life of the property.
So that was my next question. In your written proposal, it talks about ensure the development remains affordable for at least 50 years. So basically, you're just, for lack of a better term, regurgitating what your parameters are for the government finance.
Correct. So in that proposal, it mentions 50 years because that is the
Understood.
government requirement, but we would honor the lifetime, if you will, of the land lease, which is 99 years, during which period that community
Sure.
would remain affordable.
And that's provided under one of the provisions, the county writes a check for about $460K, or in another parameter, $50K.
Yes.
And at the end of 99 years, we've collected $700 and some thousand of revenue?
Correct.
Okay, just want to make sure we're clear on that. Okay, I have nothing else. Anything else from the dais? Thank you, ladies,
Thank you
very
so much
much.
for
We
your
appreciate
time.
your time. Have a wonderful day and be well. Okay, discussion amongst the commissioners.
Well, again, Mr. Chairman, I think that, each group has come before us with a very creative proposal, some of which I think have more substance than others. But I do think that it's important that our staff really take a hard look after all of the discussion that we've had today and all the questions that we had today, and they come back with a recommendation to this commission as to how we go forward from here. I think that it's important that we all communicate that the various needs, as well as just the community, the various needs that they want to have within that proposal. And so that's, as I see it, is the way that we probably, or not probably, we should proceed. Obviously, they're not asking us to make a decision today. I think we couldn't make a decision today if we're looking at all four fairly, because a lot of them have not even presented us, what exactly they want to do on the property. So I really would like the staff to take a little bit more time and really, get into each proposal and kind of like put them on a plate of, all these different things, whether they give or not give, as opposed to individual presentations, and see where we are with the recommendation.
Yeah, I think the first thing we've got to do is this board has to decide what vehicle we're going to utilize on this property and possibly others for affordable housing. I would support a work session on getting some finality to that so that staff knows where to go. I don't want to paraphrase this, and I don't want anybody to take this incorrectly, but we've almost got the cart in front of the horse with this RFQ. But it's been very informative to me to help us understand what is viable, what is available out there, which I think is good for an overall discussion about our affordable housing discussion. So I would definitely support further a work session to find out and figure out what direction we ultimately going to go. Commissioner Delory?
Thank you, Mr. Chairman. My biggest issue here, and I said it early, was that I want to make sure that we're preserving the heritage of the Wynwood community. I don't want this to turn into a housing development. If that's the case, then we can just sell the property and move on.
Right.
My biggest issue here is how are we transcending this community for future generations, and what are we doing to be that small mustard seed as we move forward to allow them to be a part of it. Just building multifamily houses, it's not what my intent of this property should be.
Right. Agreed completely. We'll go to the public here in a minute for public comment. Commissioner Lockhart, this is your district, and I know that you've been quite involved in the community and understanding what's going on and hearing a lot of the needs, and hopefully we'll hear from some today that may be on the call or in the audience. But your take?
I'm glad that we went through this process because I think it gives us an idea of what is out there in the marketplace and what's being discussed. And I think it actually revealed all of the many different options that are out there. And so that was very, very helpful. I have to agree with Commissioner Delory's point that if we were just going to have this be an affordable housing development, the school board could have done that. But the intention was that this be to the benefit of the existing community. And how do you do that creatively? And so we invited the private sector to give us ideas of how they would do that. I am a little uncomfortable, more than a little uncomfortable, with some of the idea of having a part or one entity in the community having such a big stake and say, and having some type of remuneration. I heard that potentially from two of the four proposers, one more loudly than another. That's definitely something that's a concern for me. I don't know how that's being, I do know how it's being received in the community. It's not being well received in the community. And I think we need to spend some time listening to more and more of the folks who live in the Wynwood, East Altamont area, of where they had a community meeting. We got just a little bit of feedback. 4 or 5 different community members gave us written feedback. I'm hearing feedback, not a whole lot in writing, but I think there needs to be a next step. This certainly isn't something that we need to drop. We need to continue to pursue what happens with this project for the benefit of the community. But I think we have more work to do. And frankly, I don't know, without getting direction from us, what more staff can do digging into these proposals. I don't know what that would look like for
Well,
staff.
I think.
Can I tell you what my impression is? This reminds me a lot of the circumstance we were in when we first started looking at 5 points. And we had this initial submission of public-private partnership documents, and they gave us some really good ideas about where that property could go. But at the end of the day, you decided it might be better for you to bring in a professional to help you design the plan that you want. Now, the difference in that circumstance is we were going to pay for that project completely, although initially a public-private partnership, we thought there might be some private equity in it. So that's one option that you have, is we can, now that you understand a little better what the options are, maybe developing a plan that reflects what your intentions are for the community. And then we can still work with private partners to effectuate whatever plan you pull together. But that's an option for you to think about, and I'm not going to ask you to make that decision today. I think what we can all do today is go back and sort of digest your feedback. You can think a little bit more about what you've heard today. I think what I am hearing is we're not ready for staff to come back and say, here's 1, 2, 3, and 4 ranking and a recommendation for you to select one of these partners and one of these proposers. And maybe I misheard that, but that's kind of the...
Well, I think we're in a situation with RFQ that we're actually can continue to negotiate the involvement of these individuals who have presented. I think that what I've heard, and I think maybe is a private-public partnership, in where the school board's involved in one aspect of it, we're involved, the Florida Department of Health is involved, maybe in the community services side, where the housing side is then handled by the private entity portion. But I think that's all good discussion to have at a future work session.
Yeah, I mean, I don't think we're in a position to continue to talk with each 4 of them to massage their plans. If you want to select one, we could move forward, and if there was one that was close, we could refine. It's not the impression I got today that you're ready to select one. That may be a misimpression on my part, but normally the next step would be for us to bring you a ranking and for you to select. I didn't think we were there yet, which is why we're here today.
I don't think I heard we're ready to rank. Anyone on the dais ready to rank?
Nope.
Nope, we're
No,
not ready to rank.
and we wouldn't ask you to do that today, but the next step would be to bring a proposal for you to select one of the respondents. So my suggestion would be is that we know we're not ready to do that. So based on what we've heard today, maybe we can meet with each of you individually to kind of see where your heads are, and then come back at the next meeting and talk about what the next step would be. Does that?
Commissioner Lockhart, Commissioner Delarie's had his hand raised. Go ahead.
Well, I think one of the elements of this community and the discussion that we've been having with community partners and staff was related to the Lily H. Green Community Center. And that working group was a rather large group made up of the college, the health department, the school district, different nonprofits were around that table. Our staff, Rick Durr, IFAS, I mean, everybody and their uncle that could possibly bring some type of benefit to that community in a collaborative way was around that table. It was a very productive working group. And what we really came up with, because there were other elements going on with Lily H. Green that complicated that discussion, was even if those things don't happen at Lily H. Green, perhaps that the same model could be moved to Rosenwald. And that was one of the things that I kept saying to the community is, look, I know you're frustrated that Lily H. Green is not providing the services and the accessibility that you are looking for, but hey, Rosenwald's coming, and this is going to be an opportunity to bring all of those services here in a one-stop shop, just in a different location. And so I feel very responsible having been that messenger to them, letting them know that type of collaboration was going to occur, whether it be at Lily H. Green or Rosenwald.
As it should.
Commissioner Lockhart, if I may, you may be the front person, but I believe we all shared that same philosophy. So you were giving the community our message.
I hope so.
No, I'm telling you, from my standpoint, you were.
Good.
I will tell you, if one of the things that you should be thinking about and that we're going to have to make a decision on is how much do you want to invest in public funds in the site? Because I think one of the reasons that you're seeing these proposals being so heavy with housing is that underwrites the cost of the community facilities. So if you want a more robust community facility element of this, you need to be thinking about how much you're willing to invest in that. Because I think if you start to cut down the housing, that's going to start to minimize the amount of partnership that's going to be available to fund the community element of it. And that's all fine, but just understand that I would guess if we asked the proposers why it's so heavy on housing, it's because it underwrites the cost of the community element. So just understand that that's something that we're going to have to talk about and identify what your willingness is to invest.
I think we understand that, and I think that's going to be part of the process if staff would bring that information to us on that cost. How much are we going to need to invest of taxpayers' dollars to do one thing versus letting the private sector, carry it, then we can make a better decision. Commissioner Delory.
Thank you, Mr. Chairman. The two applications, or two proposals that we're talking about, is many of the units that were there, even though there are numbers, I would have thought that they would have given us data of their analysis of what the real housing need is in that area. I have not seen that in any of the four packets yet.
I think we heard both, at least I heard at least two of them say, hey, we know there's a waiting list, it's 96, 97,
but you
then
would
there's a
think that
need.
you had seen some more data.
We didn't, in fairness, we didn't ask them for that data, but we can give you what the housing demand is. I mean, we know how many people in this community are housing burdened and can certainly get that information to you. There is a significant need, and I think you all know that intuitively, but we can get you the actual numbers.
Okay, is there anyone here from the public? And Clint, do we have anybody on the phone or electronically that wants to discuss or make a statement on this matter?
No, sir.
Okay. Anyone in the audience that wishes to speak to this work session item? Ma'am, yes, ma'am. Come on up to the podium. Yes, ma'am.
What did she say?
She said that if you're anything like she is.
Thank you.
Ms. Watkins, you can just leave it right up there on that. Unless you want to speak, that's fine.
Yes,
I want to
ma'am.
speak briefly.
Yes, ma'am. Feel free to take your mask off if you desire so we can.
Good afternoon, everyone.
Good afternoon.
Long time no see.
Yes,
I haven't
ma'am.
seen you in quite a while. I received some directives that you can't talk to me and I can't talk to you. And you can see that I followed those directions. I'm very, very delighted to be here and listening to the conversations in terms of where we're headed. I'm just delighted. I really am. And when it comes to my community, which I love dearly, what is going to happen is we want to get with those guys and we want to embrace them, because I think that they think what would happen with the return if we get money from any of the proposers, if you will, that is going to go in Chris Watkins' pocket. No, we have to circulate this money throughout the community and do what is best for the community. Thank you.
Thank you. Be well. Appreciate you putting up with us all this time today, waiting on us. Oh, anyone else here from the public that wishes to speak? Please, come up to the podium. And if you would, just state your name and address for the record. And you'll have 3 minutes.
Good afternoon. My name is Irvin Simpson. I live at 2091 South Ronald Reagan Boulevard. I'm not speaking for the community. I'm the president of East Altamont Community Association. I think my organization is one of the busiest in the community. A couple of concerns I have, when you spoke about housing, I haven't heard anybody compare the number of housing that's supposedly coming on the corner of Ronald Reagan and Merritt, there was a meeting that we had at the city that there's 120 units coming there also. So now within a 1 mile radius, or less than half a mile radius, there's 240 apartment that's coming. I've been very active in this community, and I have never heard of such a need in that small of a space of 240 apartments. If you bring 240 apartments there, then the discussion is, or some of the concerns are, low-income housing. We have a lot of millennials. My neighborhood is very proud, and we have a lot of millennials that's living with grandma and grandpa. So if we're gonna make that many apartments available, we got to consider the senior citizens in the neighborhood, and we got to consider the millennials. Most of the senior citizens own their property and has been there for more than probably 50 years. I was in the Marines, I did 23 years, I'm retired, and I came back to the house, and I chose not to move out of the neighborhood because I take care of my mom. That's her sense of peace, and that's the sacrifice I choose to make. So we can consider that when we talk about the number of housing. I heard the discussion on there's a 10% or whatever percent equity that will be given to an organization. I don't see how, if a developer gets the contract and he chooses to give 10% to an organization, I have no problem in that. The problem I would have is if that 10% or whatever that percentage is has to go through an organization to the community. That is unfair. Myself nor none of the organization in the community represent the voices and the people of East Altamont. There are individuals, they probably are elder, and they probably can't make these type of meetings, but I'm almost sure that I would not take 10% and I'm gonna distribute in the community because no one has asked me to be that voice or go get my dollar and bring me back 50 cents of it. That's not what we're there for. So if that's gonna be considered that the community can find some way to have equity into this project, then I think that needs to be more dialogue and more meetings and more face time that we invite the community out. Those that are concerned can come out and voice their opinions and say which way we're going. And I think we need to have another meeting in the community to dispel the fear. Right now, our community has a fear that we're the next Winter Park or we're the next Paramore.
Yep.
And I keep advising, I keep telling the people, the two properties that we're talking about, one is just bushes, and the other one is an old school. So Winter Park and Paramore those are two totally different situations. We're not talking about where the senior citizens are being told that they may wake up one day and you got a bulldozer in front of your house. So we can get some type of more dialogue, something more, and I'm going to continue to do my part with my organization and with the other, we'll partner with the other organization to dispel this fear that we're going to be the next Paramore, we're going to be the next Winter Park. So whichever you guys decide, and the community, I guess we'll do our best to give our input to whichever developer is best for us. If we can take that in consideration, I appreciate it. Thank you for your time.
Thank you very much.
Thank you.
Appreciate your time. Be well. Anyone else in the audience here to speak? Yes? Well, we have one of the responders. Please step up. I think I recorded about 4.8 minutes left of your presentation.
Thank you. Okay, thank you, Mr. Chair. Just, Mr. Irvin was on the call the other day, and I just want to clear up the equity portion because for some reason it seems like money will go out into the community. The equity partner from the community is a 501c3. And so that 501c3, it would be in Mr. Irvin's, East Altamont, South Seminole, they can all be part of the operating agreement. But it's run just like a 501c3. They have to comply with tax laws and things of that nature. So it's not like a grab bag where people just stick their hand in and take the money. The other thing I want to clarify is that in our proposal, we do propose offering a payment to the county. We first, in our proposal in the financial section, we asked that, quite naturally, if you could give it to us, bequeath it to the development team, we'll do that. But at the same time, we also proposed that we would pay the federal funds rate, the 10-year treasury, at an interest rate for 25 years with the principal forgiven after 25 years, but the interest payment could vary. Right now, the interest, the 10-year treasury is about 0.71% to date, but the average 10-year treasury is 4.43%. So you can talk about anywhere from $400,000 over a period of time to over the $2 million that is in the proposal. So that is written inside the proposal. Thank you.
Great, thank you. Anyone else here to speak on this matter today? Okay, staff feel they have direction?
Yes, sir.
All good on the dais? Great. Well, we will now move to item 8, which is Development Services. This is Mary Moskowitz from Planning and Development Manager will be presenting the code enforcement item, and Mr. Vincent Bavaro, Senior Code Enforcement Officer, is available to answer any questions. Tell you what, why don't we just take, Rebecca, why don't we take a quick 5?
Yeah, I'd appreciate that.
Sounds like a good idea.
We just need to take a quick break, and we'll come back.
This is my
Give everybody a
banana.
chance to get,
This is my lunch.
well, that's your lunch, you're having a banana?
Yeah, my banana. If you bring some candy down, I'll be happy.
Yeah.
Figured out the ringing over here.
Ms. Hammack, we are ready, it appears.
And the meeting just flow.
Ms. Moskowitz, how are you today?
Good, good, how are you?
Good to see you.
Good, extra long weekend here, so I'm gonna let IT handle the IT-ness and we can get started. Okay, thank you. For the record, Mary Moskowitz, Planning and Development. Good afternoon, Commissioners. I'm here to talk to you about code enforcement. On today's agenda, we're going to be talking about the deletion, recommendation of staff to delete Chapter 120 related to junk vehicles in the Seminole County Code and consolidate that with regulations in Chapter 95. We will be reviewing the procedures in Chapter 9 related to junk and abandoned vehicles, and then conclude today's work session on a discussion on a proposed ordinance to establish a special lien assessment for nuisance and lot abatement. Chapter 120 of the Seminole County Code was added in 1973 and last amended in 1977.
Wow.
Earlier this year, the Sheriff's Office expressed an interest and a desire to update some of the terminology in that chapter and to add an appeals process. In staff's review of Chapter 120, we realized that the removal of junk vehicles was already in Chapter 95. So therefore, staff is recommending to remove Chapter 120 from the Seminole County Code and consolidate all the procedures related to junk and abandoned vehicles in Chapter 95, Part 1, nuisances. So a little background on Chapter 95 related to junk vehicles. There are several definitions related to vehicles and abandoned vehicles within that chapter, the first being what is an abandoned vehicle. And it is included, it is a vehicle including the parts of the vehicle used for the, unable to be used for a form of transportation, unless it is located within a permitted enclosed structure or permitted carport. As you can see, this definition does not include the requirements for a tag, so you can still have a vehicle without a tag, and that does not necessarily mean it would be considered an abandoned vehicle. A vehicle, per this chapter, is any machine used to transport people or animals in the ground, on the air, or in a body of water, and that is included, but not limited to, automobiles, trucks, boats, watercrafts, trailers, aircraft, motorcycles, and tractors. Also within Chapter 95 is the definition of rubbish, and one of those items includes dismantled pieces or parts of a motor vehicle. So within Chapter 95, we state that it is prohibited to have an abandoned vehicle on property unless that vehicle is kept within an enclosed garage or an attached carport, or is part of an business where whose business is to keep abandoned vehicles. Or it could also be located in a lawful place, and that would not be considered a violation. So I'm going to pause here for a second to see if you have any questions on Chapter 95 as it is related to the junk and abandoned vehicles.
Any questions for staff? Seeing none.
Okay, so now we're going to move on a little bit into Chapter 95, which deals specifically with the lot cleaning and abatement program. The purpose of this program is to mitigate the accumulation of junk and debris on residential and commercial property, or the excess growth of grass and vegetation. The outlines and procedures for the removal of these nuisances is put in Article 3. Section 95.14, the elimination of nuisances, tells staff to follow the normal code enforcement process. If compliance is not obtained through that process, the Development Service Director may abate the nuisance per the processes set forth in Section 95.14, which is outlined below, and a lien is placed on the property for the cost of the abatement if it is not paid. So this is a list of the nuisances that are declared within Chapter 95. Staff is recommending and seeking direction on adding the highlighted items, the rubbish, the uncultivated vegetation, the abandoned vehicles, and the unsecured swimming pool as part of a new program for these special assessment liens. So this here is the existing process that we do when dealing with existing nuisance abatement. It sounds like some people may be getting an Amber Alert here, so. So the first is that we receive a complaint. Then the code enforcement officer will go out and inspect the property. They give a verbal notice and 7 days to clean up the property. After that, they'll do a reinspection, and if the property is not clean, they will send an official notice with 15 days to clean the property. After the 15-day time period, if the property is still not clean, they will send a final notice, giving them another 15 days to clean the property. After that, they will request a hearing. Property owners will given a 30-day notice prior to the hearing. At the hearing, the board can issue a notice of noncompliance and then direct us to abate the nuisance. If that is the case, then we can put a lien on the property for the cost of abating the nuisance.
Ms. Moskowitz, I just want to make sure I'm clear on one thing on that matter, if you don't mind. Can we go back to that? If we're following this right, it looks like enumerated, we have approximately 70 days before you get to a lien hearing? Is that a fair assumption?
The lien hearing, yes.
But that's not inclusive of any time delays from the time it takes staff to respond, send the written notice, et cetera, et cetera, et cetera. Is that a fair analogy?
So that's generally included in those day periods, but that can add some additional time, yes.
So I want to make sure we're clear. So on the official notice of 15 days or final notice of 15 days, if it takes our staff 10 days to get everything ready and send out, so the property owner then has 5 days?
No, they have, from when they receive, we send everything mail receipt.
Understood.
So when they receive the letter, that's when they have that's when the time.
So back to my point, if the entire process, hypothetically, would take 70 days, whatever time it takes staff to draft the letter, get somebody to approve it, put it in the mail, register return receipt, that's 70 plus, plus, plus. Is that fair, or?
It could be, but again, we are generally pretty responsive to that, so those time frames, yeah.
And I appreciate that. I'm trying to set the expectations.
Yes.
Because the calls I often get is, Commissioner, I called 90 days ago and nothing's happened. It's still sitting there.
Yeah.
To answer that kind of constituent and point to this is going to result in, well, Commissioner, that's great, but you said 70 days.
Yeah. So yes, we do.
So I just want to be clear on the record, 70 days is not necessarily 70 days.
It's not 70, it's 70 days from the receipt of, the time clock starts ticking when you receive the letter. the notice.
Understood. And so for the complainant, their expectation should not be what's outlined in this diagram.
Rebecca, did you have?
Sure. For the record, Rebecca Hammond, Development Services Director. I would say the diagram is a general outline. It's what we try to adhere to, but there are cases where the sheriff's office will give additional time to somebody who does have a code violation, so those times can be exceeded. If somebody is trying to come into compliance and working in good faith effort, sometimes they will extend the compliance dates. So yes, you are correct. It can be longer than the 70 days.
And so to that point, it brings up another issue, which is equal treatment under the law, which you've heard me bang on the table for the last couple of years about, which is if I'm a code enforcement officer and I have that latitude to give Mr. Smith 12 days because whatever circumstances, then that should be the same that's good for anybody else. And I'm not so sure that we're capable of tracking equal treatment under the law. So, I'll get into that later, but that's a concern that I have.
And I can,
Commissioner Lockhart?
sorry, go ahead. I can speak to that a little bit. Historically, the board's direction with respect to code enforcement has been get compliance, not violate people and get fines, it's get compliance. So we do ask staff to use professional judgment with respect to, is somebody acting in a good faith effort to gain compliance? It's actually more efficient for us to work with them and have them get compliance and take them to the board. So now that opportunity should be afforded to everybody, anybody operating a good faith effort, unless there's a life safety issue, now which is a whole other issue. But if it's an overgrown lot, if it's some sort of aesthetic issue more so than a life safety issue, we have always afforded staff the latitude to use their judgment in working with folks who have been cited for violations to try to help them get into compliance. And that should be afforded to everybody. So everybody should be treated
totally
equally in that
understood.
respect.
But I think there needs to be some guidelines on what that judgment is, because a judgment for one officer may be totally different than judgment for another officer.
We could certainly develop guidelines, but and I would caution you about guidelines, hard standards, because we box ourselves into a corner a lot of times when we do that. So we do try to rely, and my advice to you would be, if you think we're missing the mark somewhere, let's do some training rather than put down on paper a hard guideline, because we try to anticipate every situation, but we can't always.
No, I understand.
And I know that your intention is to get compliance and to
Absolutely.
work with our so I would just, that's just my suggestion, as you consider that.
No, as well as assist the phone caller or the complainant from continually burning my phone up for 200 days of why it still remains. Commissioner Lockhart?
I think Officer Bavaro was here earlier. I don't know if he had to step out, but I think he would be able to speak to that. He's working on several issues in my district right now, and every time I get an update from him, every issue is so incredibly different, and usually there are some extenuating circumstances, whether it's a medical issue of a homeowner or whatever it is, and they really, I think the sheriff's office, and it is a little difficult in that we're bifurcated, right? So you've got one entity with the sheriff's office going out and working with the community to try and obtain compliance, and then it gets shifted over to our group once that doesn't happen. So we're sort of, it's not as smooth as necessarily we would always like it to work. But I think typically when I continue to get calls like that from a citizen about a neighbor that still hasn't come into compliance, and I talk to the code officer, there's usually an explanation. It doesn't make them always happy, but there's usually an explanation.
No, and when I give the explanation, hey, they've had a death in the family, then the answer I get is, I know the family well, and they've had somebody pass every 2 weeks. I mean, I'm just saying, I mean, I think staff understands the disconnect there, but please proceed.
Okay. So staff is now recommending a proposed special assessment lien program. So we have drafted an ordinance, and that is included in your package, to amend the existing section 95.18 of the Code of Ordinances to allow the special assessment liens. The amendment section would have the nuisance special magistrate instead of the code enforcement special magistrate. Now, this can be the same person, the same contract that we already have. We would just close the special magistrate hearing and open the nuisance special magistrate hearing. Staff has worked with the tax collector's office to develop procedures for implementing those special lien assessments onto the property tax bill. The tax collector's office wanted us to note that if we do these special assessment liens, that the properties can be sold at a tax sale. And so I just wanted to make sure that you all were aware of that.
Repeat that again, Mary?
So if we do the special assessment lien program, and we put a code enforcement special assessment lien on the properties for the cost of abatements, if a property owner does not pay that lien, then that property can be sold at the tax sale.
For the price of that lien?
Correct.
Or to the highest bidder.
Yeah. So just putting that out there.
And that is after a great deal of interaction, verification, et cetera, et cetera, et cetera.
Yes.
It should come to no surprise to a property owner that that's about to happen.
Yes, exactly. For your information, for this program, we have about 25% of those nuisance cases that don't come into compliance by the hearing date. So looking at the number of cases we've had, really over the last 2 years, not including this last 6 months time period, we estimate that there'll probably be about 20 to 50 of these types of cases that would need to be abated. In preparation for this, staff has prepared that ordinance for the special assessment lien. We've worked with those code enforcement officers. We have compressed that time down some to get those properties into compliance. We've also created the budget, which was in the development services budget for the $50,000 for the program, and we've developed the draft RFP for contractors to perform the abatement.
Mr. Chairman?
So this is...
Quick question.
Commissioner Glory has a quick question.
With the special assessment, has any other surrounding counties have done that?
I believe Orange County has done this program.
They're the only other ones.
They're the only ones I'm aware of. I'm not sure if Ms. Hammack is aware of any of the attorney's office.
Yeah, Commissioner Desmond Morel, for the record. We did research some other jurisdictions. Orange County's has been the most active and probably the most successful. They've been putting forth this program for a little over 20 years, and our Deputy County Attorney, Paul Chipok, was one of the people who helped create the program in Orange. So
This is what we covered in the work session, correct? This issue?
Yes.
Okay. That's what I thought.
So this next slide, it may look a little bit different. I accidentally in your package left out a step on the final notice, but this would be the procedures for the nuisance abatement program. As you can see, we would follow the same procedures at the beginning of the program with the notification and the warnings and the notices. What is different here is then we would go into the nuisance magistrate hearing. The order would be set. If there's non-compliance, then we would go out, we would abate the nuisance, we'd go out and clean the property up. The property owner would have 30 days to pay that fee. If they don't, that cost, then we would draft a resolution which would come to you, and you would then assess the special lien assessment on the property. Then we would notify the tax office, and that would be put on the following year's tax property bill. So are there any questions on this procedure?
No, ma'am.
So what we're looking for right now is a little bit of direction on the program. The first one is the number of times we could utilize the program. Staff is recommending to limit it to no more than 4 times a year. We don't want to become the de facto lawn maintenance company for people. So if you're not mowing your lawn, we're only going to do it 4 times for you. We also were looking at
Go on vacation.
On where we want to implement this program, our recommendation would be just to limit it to the residential properties, but then we're also looking at maybe a size limit. For example, a golf course may be zoned residential. Do we really want to be going and mowing golf courses for people? The other things to consider are things like an administrative fee, especially for like a second violation. We have a repeat offender, there's some additional cost to that. So we're looking at like a $100 administrative fee to cover some of those additional costs. And then maybe if you're doing this 3 or more times, to increase that administrative fee to $200. So those are some of the things we're looking at to get some feedback from you all on as we go forward and start developing this program.
Is this staff's recommendation that we're looking at?
So staff is recommending to limit the program to 4 times a year. We had recommended the residential properties. It came to our attention we may want to look at limiting the lot size. We don't have a number in mind, but that is something to consider. And then the fees are a staff recommendation.
So to that point, in the golf course example, because I know there's been an issue previously in the county on a golf course that was overgrown, what would be done in those circumstances?
So if they did, well, we could still go through the normal code enforcement.
If you limited it to say...
If we limited it. So this process would be to do a special assessment lien as opposed to a normal property lien. So we could still go through the same process that we go through, and we could abate that process. but instead of putting it on a special assessment lien, we would just do the regular property lien. That's one option. We still have the normal code enforcement with the fines and all of that as
Sure,
well.
okay. Commissioner Lockhart?
Mary, other than mowing, what other type of cleanup services would be
So I'll go
potentially-
back to this slide here, yeah. So yeah, mowing's probably the easiest one to think about.
Right.
But the rubbish removal, so things like, trash and debris, so we could, as part of our RFP, we could ask for a company that could help clean up some of those types of things.
Okay.
The abandoned vehicles, which we talked about a little bit, do we want to include that in our RFP to have somebody remove those vehicles for us? And then the unsecured swimming pools, that's a life safety issue. So we're already
Doing that.
shoring those things up right now. The question is, do we want to make that a special assessment lien, or do we want to keep it as the property lien that we're doing right now?
Okay.
Any other questions?
Anything else?
Comment?
Okay.
Just one. On the unsecured swimming pool, that's already in the building codes of Florida, that you have to have a fence around it
Yes.
and everything. So that's actually a violation of statute.
Yes, so-
Right there, state statute.
Yeah, we're already, and we do this, we just signed off on one now, we're already securing those pools now. It's just a question of, do you want to make that a special assessment on the property, or do you want to continue doing the process that we have now where it is on the property lien?
If you all remember, we had a
Capital,
work
I'm sorry.
session on this where we asked our legal staff to weigh in and look at other options. And the problem was, when Commissioner Lockhart and I arrived here, I think the number was something like $21 million worth of unpaid
We all
code
remember, yeah.
enforcement.
52 million.
52 million, it's a big number. That we were, and all we really wanted was compliance. But there was, and some of them were going on 20 years old. And this was a tool or mechanism that staff arrived at that could help get compliance.
Yeah, and
on
I'll
this
say
issue.
on the swimming pools right now, what we've noticed is the cost of steel has gone up significantly, and so our budget isn't covering necessarily the cost to do the abatement program. So we're now having to look at other areas to budget from in order to pay for this, which we're doing. We understand this is an important process, but people just getting a property lien, it sits on their property, they don't pay it until they sell the property, so it sits there for 20 years. We're not recouping those funds.
Or the staff time and the
Oh,
cost of the staff
exactly.
time and all those things,
Okay,
which,
I'm going to show my ignorance here. The cost of steel, is it because we are securing them with some type of fencing that is made of steel?
It's the chain link fencing.
Got it, thank you.
Sorry about that.
and of course,
Why?
labor, all the
Steel.
labor that goes along with it, and, yeah, of course.
Thank you.
And a lot of it's aluminum, if you're securing the broken aluminum closure or something, yeah. Okay.
Anything else?
I don't think so. So, you're looking for recommendation on your recommendations?
In some direction, yes.
Personally, I'm fine with what staff has arrived at. We've workshopped this, I think, 2 or 3 other times. And this is, I guess, is a manifestation of our inquiries and direction from that. I think I have nothing, I'm okay with giving direction to staff on their recommendations. My concern has always been equal treatment under the law, try to get compliance. I'm not interested in owning the property or taking the property. But I also feel the taxpayers need to be compensated fairly for our staff time, which, quite honestly, we all have to agree has not been historically done. And so that's not fair to our taxpayers. It's not fair to other programs in the county that need funds as well. Commissioner Lockhart?
So I would just ask, does staff have a preference on the unsecured pools, if you would like those to continue to be in the lien environment, or if you want to move those over to the abatement process? Do you have a pros and cons on that?
I mean, I would think that either way, they will be abated if they're a life safety issue. However, I do think the county is more likely to be reimbursed if it becomes a special assessment lien and is attached to the property taxes.
Okay. Rebecca, what's the average
And I
cost?
think-
What's the average cost for that?
It depends. Anywhere I've seen usually 600, 800, 1,000. They have been increasing.
Yeah, so we had been averaging about $500 a year. Now it's getting closer to $1,000 a year.
So this
No,
also,
I'm sorry, per property, not that.
I was going to say,
Yeah, and it depends too, like on how much fencing's missing, how much actually needs to be enclosed.
Well,
Sometimes people will just have like one panel missing.
and what do we
quick
know
fix,
about
but-
foreclosed properties? The banks will sit on it forever while our costs continue to go on. And they're probably in the best position to pay it than the people that own the property to begin with. This gives them a little urgency to do what's right while we're protecting their neighbors. So, okay.
I would just caution you that some folks might not have that money when their tax bill comes due, so.
Well,
Just so,
I can appreciate that, but I don't want to answer to some next-door neighbor's little daughter who was drowned in the pool because we, A, didn't get to it, or B, we did get to it, and we didn't find it a second time or a third time. I mean, sooner or later, there becomes responsibility that comes with the ownership of
and
property.
I'm not suggesting that we not abate it, I'm just saying if you consider which lien mechanism you want to use, whether it's a lien on the property or a tax bill lien, you just might want to consider that, because some of these folks, the reason that it might not be repaired is that they can't afford it, and they may not be able to pay it when their tax bill comes due, so then you've got a delinquent tax situation. I'm just
And they have
throwing it
the
out there for
ability to come,
consideration.
they have the ability to come address us, correct?
Yes, so at the point that the
And the
county would actually,
magistrate.
except for the pool enclosures, since that's a life safety issue, the other abatement or other nuisances that we're proposing to abate, they would have gone through the full code enforcement process and would have been given the opportunity to, remedy the violation themselves. It's only at the very end, if they still haven't come into compliance, that the county will then step in and abate it.
And so, how confident are we the numbers that staff has proposed do in fact cover our true cost of staff expense? We've looked at it.
Yes, so I think
From-
one of the things, this was based on not including the last 6 months of cases, because the cases have been told, but looking at the cost, especially for the fences, I do think this is a reasonable budget that we've put together, and a reasonable expectation for the number of cases that we're going to see.
No, but what I'm saying is the cost that you're going to assess a second and third time offender, does that truly cover the cost of our staff time and so forth?
Probably not, but it's an additional fine that makes it a little bit more uncomfortable for somebody to reoffend. But of course, it's not going to cover 100% of staff time.
Yeah, and see, that was, of course, my goal was to make sure our staff time is truly covered. I mean, I get it, we have to do a service for the public, but this is not really a service for the public unless it is a fence that's unsecured or a pool that's unsecured from a safety perspective.
Mr. Chairman?
So I'm okay moving forward with it.
I'm the same way. I've said this many times. Every time it would come up, code enforcement, is this truly how much it costs the staff? And it never really was. And this, as Commissioner Zimbauer just said, this is not a service provided. This is going out extra because they have not done something that they're responsible to do. And in those circumstances, I truly believe that we should get the full cost of the administration and staff time.
So just to clarify, when we actually would do and Mary, correct me if I'm wrong, but the way that the ordinance is written is that we would include the administrative costs
Yes.
within that special assessment lien.
Correct.
It's just the additional, the $100, the $200.
I mean, that's
for
the staff's
yeah.
recommendation, correct?
Yes.
Legal, are you able to
Yes.
support that?
Yep, that's fine.
Okay, then I'm okay with it.
The only thing we did not include was interest. Some of our liens do include interest, but we did not include interest.
That's dictated by statute, isn't it?
Yeah, we'll have to take a look at that.
Yeah, I think that's dictated by statute, so whatever the statute allows, I think I would adhere to the statutory requirements. All right,
Well, thank you.
Good. Anything else on that?
Yes, so the only other thing, back to Chapter 95, that we wanted to get direction on, because it was brought up at the last public hearing we had when we originally brought Chapter 120, was the definition of an abandoned or junk vehicle and whether that would include a tag and registration. Mary did do some research on other jurisdictions to see who in fact does enforce that. So we didn't know if you wanted to have any discussion on that and whether you wanted us to propose an amendment to the definition to include requiring registration and a tag.
So what is staff's recommendation on that, and what has your research discovered?
So within Seminole County, most jurisdictions do require a tag to be considered an abandoned vehicle. The exceptions are Longwood and Winter Springs. And then Oviedo does not explicitly require a tag to be considered a not abandoned vehicle, unabandoned vehicle, but they say that it could be used as evidence in the case. And I actually found that language the most interesting.
I do too, as a matter of fact.
And then all of the other surrounding cities and Volusia and Orange County, they all would consider a vehicle without tags at an abandoned vehicle.
So make sure I'm understanding, but a vehicle with a current tag would be considered not abandoned regardless of its condition?
Not necessarily. That is just one of the things. So, for example, Orange County says if you have, flat tires, dismantled, you're wrecked,
Sure.
or you're parked there with no license plate, all of those things would make you considered an abandoned vehicle.
I think I sort of like Oviedo's terminology, that it could be used as evidence, but not the full evidence. I mean, I don't know what everybody else is. I mean, I just know from being in the business, I can tag a vehicle and register it, and it may not even have an engine or transmission, and I don't plan on putting one on it for years, or it could have flat tires, or it could be leaking transmission fluid down the driveway into the sewage system. I don't know. What is everybody's thoughts?
So I am not the car person to have this conversation with. So I know the bulk of the conversation that was had last time was about people perhaps restoring cars, and there was, concern about someone being tagged as having had a junked or abandoned vehicle, but they were actually in the process of restoring it. And I don't know if when someone's restoring a car, if they have a tag on it or not. I don't know. So for that reason, I would be more inclined to say allow the tag to be evidence of whatever may support.
That's exactly
as
what.
Opposed
correct.
To.
When you're restoring a car, it can be at several different levels for a long period of time.
That's right. It
Sure.
could be not tagged for 10 years.
Yeah.
I think it should be used as evidence.
I think
Yeah.
it should be used as
I like
evidence.
that. Hey, give Oviedo props.
I found
we
theirs
don't give
most
Oviedo props
interesting.
enough.
Yeah.
That was good.
Yeah, I mean, it's part of taking everything else holistically into consideration of what's, I mean, if you talk to the person, go, hey, well, I inherited it and I'm getting ready to restore it, or I'm doing this or doing that. But at the same time, you don't want everybody having the excuse, I'm restoring my car.
Yeah, that'll get around pretty
Forever.
Forever.
And I've seen some cars
We can draft
like
some
that.
language then and then include that statement similar to what Oviedo has and bring that back to y'all.
Sure.
That's
That's
clever.
fine. Yeah, that's fine. Good. One note that I have, I would like to discuss on this matter, not related directly to this matter. I know it's been 43 years since we updated this portion of the code. Can we agree that it would be wise for us to put some kind of trigger in place that we should at least do a drive-by every 5 years? For new technologies, new things happening in the community? I mean, I don't know what happened. Obviously, something happened pretty paramount in 4 years between 73 and 77, so I would imagine a commissioner was very vocal because the constituents were very vocal, so we changed something in 4 years, which means for 43 years, we've just been doing things the way we do it.
So,
Nobody's complained.
Right. Or have and fallen on deaf ears.
Right. Well, and Chapter 120 has been historically enforced by the sheriff's office, and that's what their officers use to tow vehicles off of public and private property. And the county has typically relied on Chapter 95, which has been updated within the last 5 years. But now, after discovering there was not an appeal process in 120, and then we discovered the redundancy between the two chapters, the sheriff's office and the county staff has said, okay, let's eliminate Chapter 120 and just put everything in Chapter 95. So yes, but it's taken
Okay.
a lot of years to get
But
there.
does it make sense, and maybe I looked at legal counsel for this question, does it make sense to do a drive-by with these things every so often, just as a review process?
Right, and just to make sure I'm understanding this correctly, so whether there should be a mechanism in place to review specific ordinances or...
Or for that matter, all the ordinances? So we don't have the old,
Just like.
whatever, if you wear your shoes wrong back in 1885, you could go to jail.
Yeah, I mean, there's nothing preventing us from reviewing those items.
I mean, the only reason I bring that up is it seems we continually find things that are
Mr. Chairman,
way old.
maybe 5 years, maybe a little bit too quick, but definitely within it, every 10-year period, that staff should at least look at everything, decide what to bring back to us.
And I will say that the statement was it was last amended in 1977. I don't know, it could have been reviewed in the last 43 years
Sure.
too. So
Right.
I apologize if that caused any confusion.
But I would
No,
agree,
not at all.
Mr. Chairman, but I would agree, 43 years is a long time.
Yeah. Okay, so I will support whatever review process it is. I'm just not a fan of waiting till, something blows up before we address it. And we should know from our other counties, our sister counties and cities, what they may be experiencing. We should follow and just review periodically, but that's all I have. Anything else from the commission on that matter? Anything else from staff today that you need direction or need us to consider at all?
Mr. Cole.
Anything from the commission?
County Manager, did you want to give us an update on the CARES Act?
But I will. I want to make sure Rebecca and Mary have sufficient direction.
Yeah, so we'll prepare an ordinance in conjunction with the county attorney's office and then bring that forward to the commission for consideration. I think we'll bring it forward for a public hearing rather than another work session.
Or bring it forward for our approval, put it on a consent agenda, it sounds like.
Well, it'll have to be a public hearing, but
Yeah,
Okay.
okay,
Okay.
yeah, it's fine.
All right, we'll proceed in that way.
Okay,
Thank you.
thank you. Okay, Madam County Manager,
all right, I have.
CARES update?
And out of respect for everybody's stomachs, I will go very quickly. Let's see, back here. Share my screen. Okay. Another CARES Act. So I'd like to start with the allocations, which sort of change every time I talk to you as we learn more about community needs. You'll notice probably the most significant change from the last time we talked is with respect to individual assistance. You're all aware of the volume of applications we've received. We've had 11,000 registrations. We've tried to calculate out how that might be based on the average award. We think we're going to need about $8 million more in that allocation in order to meet the existing needs. Ernst & Young started last week going through all of those applications. So I have shifted money out of the replenishment fund into this allocation. I've also made some adjustments based on actually adjusted down in the public safety, service, and health expenditures. We've been sort of refining what our needs are. You had on your agenda today the interlocals with the cities. That's remained pretty consistent. I expect we might see some more claims from them as we move forward, but I think we'll be able to capture that within the $36 million that we've got allocated there. We also shifted down the special economic recovery initiatives based on the new proposal we got from Seminole State College. We just sort of put a placeholder in there, and I'll talk to you about that a little bit later. So that leaves us with about $15 million of unallocated money that I think will is a good sort of buffer to have as we see new needs coming up. So we'll keep you posted. I'm sure this will change next time we talk. Just a reminder, this is just a reminder of what our allocation, our awards are under the Small Business Assistance Program.
Phase 1, which was our pre-portal phase, we've closed that out, and we awarded $2.5 million in grant funds for almost 300 businesses during that phase. Our portal with Ernst & Young opened on the 19th. We had almost 4,500 businesses register. Of those, only about 1,800 of the applications are complete. I shared with you when we were doing the pre-portal process that it was difficult getting folks to complete their applications. We continue to work with them to try to get there. Ernst & Young started their review of these applications on the 2nd. We had 40 reviewers last week. We're going to have 80 total moving forward for both the individual assistants and the small business assistants. And then we have been, just so you know, we've been working with the clerk's office in order to make sure that we can get the checks processed as quickly as possible. On to individual and nonprofit assistance. There have been no changes to the proposed allocations, but this is just a reminder for you for your reference. In phase 1, which was again pre-portal opening, we provided assistance for almost 400 residents and a total funding approved of $1.3 million. We have cleared that waiting list, and last time we talked we had a number of people still waiting for assistance. So everybody now is in the phase 1, the phase 2 portal system. We shared with you recently that we put that system on pause because we had over 11,000 applications. Of those, 6,400 are complete, and 5,100 of them are still in draft. We closed the system to all applicants on the 4th. When we closed it down a week or so ago, we allowed folks that had stuff in draft to continue working on them. Contacted everybody directly to let them know that was the case. So we'll move forward and kind of see where we are. We estimate that about 40% of the applications will be eligible to be funded, which will put us beyond, if everybody on the list is eligible, it puts us beyond the 18 million, but we think some of those draft applications will probably drop out. So we'll give you an update in 2 weeks to let you know where we are on that, so we'll have an idea of where we are from a funding standpoint, and if we need to change those allocations at all. Last time we talked a little bit about eviction relief. We're a little bit further along than we were last time. We were coordinating with legal aid and the clerk's office and judicial to come up with a system to help people who were facing eviction orders because the governor's moratorium on evictions has been modified. And we expect that some people will get captured in that and will be facing eviction orders shortly, or eviction actions. Legal aid has developed a stay order, and they have reached out to the firms in our area that the primary firms that handle landlord-tenant. They work a lot with them, so they know who those firms are, just to let them know that we've got this program online. The individual assistance application, we've added a field so that folks can identify whether or not they're facing an eviction notice, and we'll give them priority for review. We also, since we have the system closed right now, community assistance is setting up sort of a hotline email system where folks that are not in the system but have suddenly received an eviction notice can contact us directly, and we can work with them while we're working through the other applications. And we also talked with you last time about giving folks that are facing eviction a little more assistance than we had originally proposed, giving them up to $7,500 as opposed to $5,000. We'll probably be working with the SHIP funds to kind of take them from the $5,000 to the $7,500 because that program is a little more cumbersome. And so if folks need more money, we're going to make them go through that system because it's not as accessible to everybody else. So, so we'll keep you posted on the progress there. Today you dealt with our first round of nonprofit awards. There were 11 in that batch, and they represented about $1.1 million. We've got 60 some odd applications to date. They keep coming in. Our priority as we review them is for essential services. There are all kinds of nonprofits, as you're aware. Not all of them provide essential services to our community. So the ones that aren't essential service providers, we've sort of put them to the back of the line, not saying that we won't be able to fund them, but we're going to give priority to the entities that provide essential services.
You may have noticed this morning in some of the awards that you approved, what we recommended for an award was a little bit more than what they had actually asked for. And I just want to explain that publicly. We work with each of the applicants directly as we review their applications. We have a committee. Carrie is heading up that effort. She and Allison, their group, are taking the lead on that. But we work with them to try to really understand what their needs are. The CARES Act, we work with it every day, and we're confused by it every day. So trying to help our nonprofits navigate through that, we think it's important to deal with them because they have very specific guidelines that they have to meet that we don't have to meet under the individual assistance or small business program. So some of them miss the opportunity to make claims for expenditures that they had already incurred. They were just looking prospectively. So we tried to identify everything they were eligible for because they do provide essential services, and frankly, if we can't make them as whole as possible now, they will probably be back in the spring when we don't have CARES dollars available. So we want to make sure that we capture as much as we can with this funding opportunity. So that's why there might have been a difference in what they had asked for and what we were recommending with respect to awards. County departments, the public safety, which includes counties, cities, and other public agencies, we are still refining our anticipated costs. I think we estimated at about $20 million last time. We're down, we've kind of refined that down to $17 million for the county itself. The cities have submitted requests totaling $5 million. We expect that might grow a little bit as they move forward, but we think we've got enough allocated to cover all of that. The same is true for the constitutionals. They also came in at about $5 million. You, of course, have approved an allocation to the school board for a little over $8 million. So that remains pretty constant. And we'll continue to work with our public agency partners. This is just the same thing you saw last update with respect to tourism. The one thing that has changed on this slide is workforce development. We've been working with Seminole State College to put together a workforce training program mostly focused on rapid credentialing so that we could get folks back into the workforce. We worked with them to try to leverage some other dollars that they were getting, and the estimated cost right now is almost $500,000. So the one thing I am going to ask you to do today, I sent you the details on this when I sent the update, is to again give me authorization to work with that number, and we would bring back so that the college can start moving forward, and we would bring back the actual agreement for you to ratify at the next meeting, just like we did with the school board.
Mr. Chairman, move to approve the request for the county manager.
Second.
Motion is second. Any further discussion? Roll call. Commissioner Lockhart?
Aye.
Commissioner Delory?
Aye.
Constantine?
Yes.
Zembauer, yes.
Thank you very much. So the next slide is something that I just want to put on your radar. And this has changed since what I sent you the other day. We adjusted the number that we had for actual county expenditures, which includes what we've cut checks for versus what we have in the hopper that we're in the process of purchasing. We're at about $10 million now. I had a lower number in there. It didn't seem right to me, so I got with Tim this morning, and we clarified what that number was. The small business matches up with what we shared with you earlier in this presentation. Same with the individual assistants, municipalities, and the constitutionals each at $5 million. The nonprofits, the $1.1 million that you approved today, and then the other agencies include the Seminole State that you just talked about, the school system, and then the zoo. I want you so that all adds up to about $35 million. These are the commitments that we have to either reimburse public agencies for expenditures they've had, or commitments that we've made, checks we've cut for direct assistance. We have $20 million, a little over $20 million in hand right now. We only got the first 25% directly. I just want you to know that we're not sure yet how we're going to get the remaining 75%. We've been working with the Department of Emergency Management, which is the state agency that's administering those funds, trying to get a fix on what we need to do to access the remaining 75%. And I think they're overwhelmed, just like we all are, because this has come so quickly and we have so little time to spend the money. They haven't been able to tell us what we need to do to start accessing that money. We anticipate an answer soon, but I just wanted you to be aware that our commitments exceed what we have in the bank right now.
Don't write those checks.
So some of the reimbursements for some of our partners, maybe slow walked a little bit until we get a better understanding. We're pretty confident that there's not going to be a switcheroo on us, but we're keeping our eye out. I legitimately think that it's just DEM hasn't had a chance to really understand or have gotten direction from on high as to what they really need to do in order for us to access that money. But we'll keep you posted on that, and we may sound the alarms if we need folks to start making calls, but we have been working with our lobbyists to try to get some answers, but we're mindful of this every day as to, we don't want to overextend ourselves until we know we're getting the remaining 75%. So I'm going to leave you with that thought. There's nothing else unless you guys have any questions. You've already authorized the Seminole State, so we'll bring you the funding agreement on the 22nd.
Any questions from the board? Seeing none?
Thank you.
Anything else, Ms. Gay?
No, sir.
Anything else from staff? Seeing none, we're hereby adjourned. Thank you all.
That's quick.